Okay, we're live.
Nanda Pab Khoisto, welcome to our Health and Care Scrutiny Committee. Today's job is to scrutinise the health and social care budgets, and those are our main agenda items. Before we get to that, I'm just going to go through some housekeeping. First of all, apologies, please, Wyn.
We've got a few apologies, Chair, from Councillor Pete Lewington, who's Vice Chair of the Finance Panel. Gareth Radcliffe, member of the committee, is going to be late, and then from three other members of the committee, Benjamin Breeze, Gareth Morgan and Josie Ewing.
I've also had apologies from Councillor Jonathan Wilkinson as well. Item 2, disclosures of interest. Anyone got any conflicts of interest disclosures they need to make in relation to anything on today's agenda? If you think of anything that you've not thought of now as we come to it, there's a lot here in relation to different service areas in the two services. Please don't hold back in speaking up if that comes to mind, even though we've passed this item on the agenda. Item 3, disclosure of party whips. No. Right, we're on to the main event. So we've got the draft 23-24 budget. I understand we're going to have a brief summary from Jane Thomas, a Section 101 officer, and then we'll be going on to presentations from the services, and we'll be starting off with looking at children's. But on that note, I'll hand over to you, please, Jane, just to give a general overview, introduction, please, to the wider budget and its implications.
Thank you, Chair. Yes, so Scrutiny Committee today will be reviewing the detail in terms of the budget plan for that relation to social services, including adults and children's. But I just wanted to give you an overview of the budget report the Cabinet considered on the 17th of January. You've all no doubt been able to read this, so I'm not going to go through it in any detail, just highlight some of the main context within which we've actually developed this budget. So the proposal includes a medium-term financial strategy for a 5-year period from 2023 to 28. It also includes the financial resource model that accompanies that strategy, a draft revenue budget and a capital programme, a draft capital programme for the same 5-year period. I think it's worth noting that in developing the plans at this point in time, everybody is aware of the extremely challenging economic environment within which we have developed this budget plan, mainly linked, of course, to inflation being as high as we've seen it for many, many years, but also the ongoing impact of the war in Ukraine and the impact that's having on prices. All of this has played a part in terms of what we've had to manage in terms of developing the budget plan that you see before you. In terms of the longer term, we know and we expect to be having a significant challenge over the 5-year period. We're already getting an indication, should the current government stick to its spending plans, or if they are picked up by future governments, that we're likely to see public sector spending under a considerable challenge for many years to come. So I think this is the start of the first of those sort of real years of challenge that we're likely to see. So we have to be mindful of that in terms of the context within which we're developing this year's budget and the longer term plan. The report that Cabinet considered on the 17th of January includes many sections in the report. It looks at the settlement that we've received from Welsh Government. It's the provisional settlement. We'll have the final settlement confirmed on the 7th of March, although we will have quite a clear indication of that by the time Council considers the overall budget towards the end of February. Within the settlement, there is an element that relates specifically to social care. And that's where Welsh Government have recognised the role that social care plays across Wales in supporting our residents. And as to that effect, they have included funding within the settlement to support the continued rollout of the real living wage. That being said, in terms of the amount allocated, which is 70 million across Wales, I think our share of that is unlikely to meet the full costs of what we're expecting to meet to deliver that ourselves. So although that funding is welcome, the total pressure that we estimate is included in our budget plan. The remainder of the report then goes on to set out how we fared in terms of the settlement. Powys has received an increase of 8.7%, and that equates to an additional 18.298 million. In line with that and what we're expecting to have to spend next year, we've had to balance up that budget by a proposal with an increase in council tax at 5%, but also with significant savings of over 16 million put in place or proposed currently across the whole of the budget. The detail in terms of each of the services is included in table 5 in the report. That sets out the current year's budget for each service, but then looks at the pressures facing those services and the savings being proposed by each of those services to get to the proposed budget allocation for each service for next financial year. And I know that the appendices that have accompanied the budget report are where you focused in terms of your work and your scrutiny today, looking at those that specifically relate, as I said, to the social care budgets. I'll leave it at that, Chair. Happy to take any questions or input as we go through the committee, but I hope that gives you sort of a very broad overview of the budget proposed.
Thank you, Jane. I understand, well, we actually have put a couple of questions in advance to you in order to explain some of the background to the budget, and I understand that Jackie's going to give a quick overview of that now on some slides. And Councillor Gareth has put those questions together, so Councillor Gareth may want to come back on it. Just as a quick question from me, and you mentioned about there being some specific funding in the settlement, which is for social care, which you mentioned about Powys receiving as part of the 70 million that has come to Wales. Can you please provide the specific figure in relation to that?
We don't have a specific figure. It's not itemised separately in the settlement. So what we've done is, based on that 70 million across Wales, we've looked at what is roughly our share of around the 4%. And Jackie will correct me if I'm wrong, but we've estimated that to be about 2.8 million additional funding included in the settlement for Powys. And I think, as Jackie may well pick up a little later, that the cost to deliver that real living wage across all of our providers and so on is over 4 million for the authority. So that level of funding that we anticipate and estimate has been included in the settlement falls far short of what we actually need.
Thanks, Jane. Over to you, Jackie. Jackie, do you just want to, as well, when you start, just to explain what your job role is as well, just for the public? Okay.
Can you hear me?
Yeah.
Yeah. And have I shared my screen?
You have.
Okay. I'm Jackie Pugh, and I'm the finance manager for social care, which is adults and children's. And what I'm going to show you here now is the questions that Councillor Gareth raised. So the settlements for all of Wales at 22-23 was the 5110. The original increase was 3.5%, which was 178. The extra increase that came for 23-24 was an extra 4.4%, which amounted to the 224. So the AEF for 23-24 total is 5513. For Powys, in real terms, we got 8.7% increase, which was, as Jane mentioned previously, the 18.298 million. And then the indicative amount for 24-25 is 3.1. So the Wales figure was 7.9, which were those two amounts added together, but Powys got 8.7%.
Okay, thank you.
So the standard spending assessment is where Welsh Government take all the assumptions from any base data and statistics that they've been gathering and work out the amount for Powys. But obviously the funding to the council is unhypothecated, so the decision is here locally within Powys. But using those figures, you can see below, if we just concentrate on personal social care, the Powys base data is 84,275, and what we actually got was 91,34. So that's an increase of 5,859. And as Jane previously said, using that data and the figures, it would seem that the real living wage that was funded within the RSG was the 2.8 million. Using these figures and the data, it can then be split down per area. And for this committee, I suppose the interest is in the personal social services element, which is a total of 9134. For older adults, residential and domiciliary care, it's 4615. For younger adults and personal social services, it's 3132. For children and young persons, it's 19057. And for PSS administration, it's 262. And for the NHS funded nursing care, it's 69. And there is detail throughout all the service areas, and that's where that then ties into where our base budgets are then made up. And we'll go, I suppose, through this in further detail as we go through the service areas.
Okie doke, thank you. Councillor Gareth, do you have any follow-up on any of that, given that you were the one that raised the issue of these background areas? Councillor Gareth?
Sorry, Chair, I was muted myself. Just on that last screen that Jackie had, there's a figure there for pay awards of 3% for next year, but that seems to be different to what's in the actual paperwork that went to the Cabinet on the 17th.
Okay, what's been built into the individual service budgets is the 3%. And then the difference has been held corporately, but will, at this point, will be divvied out further down the line, because there's also an adjustment since we prepared the paperwork on the NI and the superannuation contributions.
Yeah, okay.
Which almost net out miraculously.
Yeah, but it's nets out, but not against individual services, does it?
No.
Schools will be more than others. Okay, no, that's fine.
No, it will be done before the end.
Will that be done before county council in February?
Jane, sorry, I need your assistance now.
You're on mute, Jane.
We don't usually amend it to that level of detail, because we usually wait for the pay award to be confirmed before we'd make those allocations, because it could change dependent on that. But I know we're looking at it behind, because obviously there's quite a high level of impact across all services there. And I can see from a councillor perspective, you want to see how that impacts on individual service budgets. So we are looking at that with an aim to final, or make it a little bit more understandable, if not the final figures by then. If I could as well, Chair, I just wanted to add a little bit of context, because I know what Jackie's presented. Some members will understand what that was and some won't. Could I just add a little bit more context to that?
Yeah.
So the standard spending assessment is the blocks of money allocated through the formula. It's a very complicated formula, and I'm not going to even attempt to try to explain it in detail here today. But what it would include would be any changes in the data sets. So population is a big driver. The numbers of people at certain age groups would drive that formula as well, together with those receiving benefits and things. All of that data feeds into the formula and then generates the budget share for each local authority. And it's very difficult to predict that, because obviously each authority's data will be different, and it's only at one point in time that we all understand that. So although that's the means of driving the formula, as Jackie was quite clear, the standard spending assessments are an indicator of potential spend, but they do not then consider the specific circumstances at each authority. So that is there where the council decides how much it wants to allocate to those service areas across the piece. So just to set that in a little bit more context, it's the means of having a look at data and understanding it a bit better, but it isn't a dictation of how we need to make our spend.
Yeah, no, I appreciate that. Thanks for that explanation. Councillor Chris, have you got a question on the wider sort of general things that we've just heard?
Yes, Chair. It was just in relation to what Jane had just commented on about the formula that is used. Can I just ask whether rurality is taken into consideration within that formula?
Probably not as much as we as a rural authority would like. I think it's a very difficult area to actually establish. There are some rural things that are included in the social services data, which was a change that was put in place a few years ago now, and we did benefit from that. I think that was starting to recognise the additional cost of delivering services in a rural authority. So yes, there is some aspect that relates to sparsity and different areas like that, but I think we as a rural authority would like more to be reflected in that way, and it's something that we look at through the distribution subgroup, of which I am a member, that actually looks at the formula.
Okay, thank you.
Thanks, Chris. On that note then, I think we're ready to hand over to the children's team to do a presentation on their specific budget position that now comes under that wider umbrella. So I think Nina's sharing her screen. I understand Sharon's going to be presenting, is that right?
That's right. Thank you, Chair.
Okay.
And Chair, I will present first of all before handing over to Sharon, if that's all right. Introduce, sorry, not present, introduce.
You will introduce Sharon, that's absolutely fine. Okay, so we have got in front of us your slides, and I will welcome Councillor Susan McNicholas, portfolio holder for Children's, to committee. Thanks for joining us today, and for you to introduce the relevant officers, please, Sue.
Thank you, Chair. And thank you for the invite this afternoon to myself and to Councillor Sandra. Good afternoon, everyone. Pnawn da pawb. We would like to present you with the proposals for the Children's Service budget for the next financial year. We have looked at all areas within children's services and mapped out what we think is a realistic proposal. Children's Services covers a wide range of interventions, from early help services through to children who are looked after. The service is complex with many competing challenges that are thrown at us. And therefore, we have considered every part of it during the budget setting process. I'd like to thank Sharon, Michael, Rachel, Lynette and Nina for their participation in this report and their hard work in producing it. So now I'd like to introduce you to Sharon Powell, who will take us through some further information. Thank you very much, Chair.
Thank you. Welcome, Sharon.
Good afternoon, Pnawn da pawb. I'm Sharon Powell. I'm the Interim Head of Children's Services, and I'm going to kind of talk to you over the next sort of 20 minutes or so about children's services as a whole and our budget setting process. So I came into post on the 1st of September 2022, and one of the tasks that I was set with right very early on in September was budget setting. So in order to kind of look at the budget setting for next year, what I needed to do was kind of go back to basics really within children's services and kind of scrutinize every layer of children's services in terms of every line that has been produced in terms of the budget setting process, and to kind of review really what was working well, what were we worried about, and what could our next steps be. And that was a really interesting process for us back in the autumn of last year, and it united the children's leadership team in terms of just working together, looking at every service area in terms of minute detail, in terms of exactly what I said around what was working well, what we were worried about, and what would we do or consider as next steps. What you'll see on the screen is the children's services plan on a page. So this is fundamentally the vision of children's services. So we don't need to recreate this. We don't need to do anything different right now. This actual vision here that we see on the page is the services that we've built on over the last few years. And this is certainly an aim and objective to take this further forward over coming years. It really looks at the ethos of the Social Services and Wellbeing Act that came into power on 2014, and it kind of just highlights really all those service areas that kind of are indicative of children's services. So we've got at point 1, we've got that range of early help services. We know that the council have invested hugely in terms of early help services over the years, and they're really critical as part of that Social Services and Wellbeing Act promotion, in the sense of co-producing, working with people, trying to build stronger communities, and working with children and families and young people at the earliest possible opportunity in the right way with the right service. So that's really important in terms of just strengthening communities, looking at solutions that exist there, and then working out next steps for that. Where there are children and young people and families that require statutory services, what we're always focusing on is that early intervention and prevention at every single opportunity. And again, the council has invested really heavily in this part, and that's really helped us kind of continue that ambition really of keeping children safely at home, within their own families, with their connected people, and within their communities. So all of that is working with children and young people and families, and that's, like I said, working with, not doing to. So it's working very much with a really strong progressive value base in terms of being open and really working together in a cohesive way, which is what co-production is all about. Then we come on to kind of those areas within the statutory service where we might need to look after a child, and these children can be from babies right through to our care leavers, and this is where, under really difficult circumstances, we may have to make some difficult decisions with families around a child not being able to live in their home environment. So this is where we need a really strong focus on what do we need to do as corporate parents, and where do these children need to live. So that can be in our own in-house foster carers, it could be with independent foster carers, it could be with residential care, or it could be 16+ provision in a slightly different way, or it could be supported lodgings, or it could be with connected people that are associated with their families. All of this kind of works around producing what we call best outcomes for children and families. So even though a child might come into our care, then we're always looking at reunification, looking at that child going back to their family or living with connected people associated with them, where they can achieve the best possible outcomes. And the greatest resource for children's services is its workforce. So we need to kind of build and develop a skilled and supported workforce that enables us to deliver all those aspects of children's services that I've said. So we use very much a signs of safety approach. That's a strengths-based approach. It's always looking at what's working well, but it also looks at identifying worries and then builds in next steps. So we use that ethos really in terms of looking at the budget setting, kind of reviewing our vision of children's services, looking at what our key objectives were for the next year, and then looking at the budget position and looking at the strengths and weaknesses within that budget. So this kind of slide moves on to a next one, which is kind of giving an overview of the budget. So you will see on the left-hand side around the figures around the base budget of 27,897. And then you will see with the red highlighted at the top, the different pressures that exist. So some of that we've just touched on previously to do with the pay awards, etc., that come along there. And then you'll see a box which says pressures, which is 2.201 pressures. And we'll come on to talk about that in a little bit more detail. And then further right to that, you'll see the savings, which is 2796, which again, we'll come on to talk about. And then it moves across to the undelivered savings, which again, I've got a slide for that at 1278. And then it moves across to the request for 2023, etc. at the end of the slide. So moving on to the pressures, there are some new responsibilities that we have as an organisation, and that is around our unaccompanied asylum-seeking children. So this group of young people are children and young people that have travelled enormous distances across Europe and further afield from that. And they've arrived in the UK, they're unaccompanied, so it means they are on their own. They don't have a parent or a relative or a connected person with them. And as you are probably aware from the media and the information that comes onto the news around how Kent local authority has been under extreme pressure and difficulties due to just being Kent where it is, and that being the shortest crossing across the channel, that they have an influx of hundreds of young people arriving in Kent every day. So the Home Office has and UK government have mandated against this, and every local authority in the UK has a certain percentage of young people that they need to care for. And here in Powys, we have an allocation of 20 young people. Currently, we have 13 and who we look after. And most of these children and young people, originally, we placed them into London provision. And one of the reasons for that really is around their ethnicity needs and their cultural needs and their connections with other people of similar experiences. And generally, a lot of that provision has been kind of located in London. But through kind of reflecting on this in the autumn, we kind of thought, actually, do we not need to kind of think about this in a different way? And so we do now actually have some young people living in Powys, and we do have some other young people living closer to Powys. So whilst originally we were looking at that London provision, we are invariably looking and considering that, are there any other things that we can do differently? Could we kind of think about what's best for these young people in a different way? And so that is an ongoing pressure for us, but it is something that we are constantly reflecting on about how to do something different. In terms of placements is one of our biggest areas of pressure. There is a national shortage of placements, and children and young people who have really high complex needs need sometimes to live in what we call residential placements. These placements are hugely expensive. It's a captive market for those particular residential homes, and this has continued to be an ongoing pressure for children's services stemming back some time. So hence why it continues to be a pressure here. Often it's something you can't quite really predict because a child's circumstances can change, the complexity of children can change. For example, we may get a referral today in respect of a child that we didn't know about, and that child might have hugely complicated factors and complex needs, and we may have to look after that child. So sometimes it's really difficult to predict that. But looking at the budgetary position from last year and looking at the forward planning for next year, this particular figure has been worked out using all of that information and data. And this is considered to be an ongoing pressure into next year. The other pressures you will see on the slide are contractor provider uplifts, and then we've got our in-house return to residential situation at the bottom in terms of that information. So further on from here, we're now looking at our savings. So in terms of savings, and to kind of consider and reflect upon what I've just put forward as pressures, what we're constantly doing is reviewing our situation for all our children looked after and our 16+ provision and our care leavers. So we have reconfigured what we call our closer to home strategy. So I put together a closer to home board, which we got up and running in the autumn. And that board looks at our internal processes. It looks at key objectives and key aims for us over the next 12 months, but beyond that too. And a big factor around that is kind of looking at our children and looking at where is the best place for this child to live. So if a child is in residential care, we're looking at, can we step them down out of residential care into foster care? Can we step them into our own foster carers? Can we stop our children that are in our foster carers homes back home? Or can we look at our independent fostering association placements, and could we look at bringing our children back into Powys from those particular providers? So we're constantly looking at what we can do and how we can do it. And you'll all be aware that we're trying to increase our number of in-house foster carers and also increase our number of in-house supported lodgings providers. And all of that will help generate that interest and ability to look after children in different ways, and also look at our aims of getting children back home or into living with connected people that are associated with their families, etc. So all of this, although it's separated out in 3 different areas, kind of sits under that closer to home project. It's about looking at our care leavers, but it's also looking at our 16+ commission services. Quite often we've had to place out of county when a young person is 16 and they can't live at home for whatever reason. We've had to look at resources outside of Powys. So what we're trying to do is build that provision in-house within Powys, and that all fits with our stronger, fairer, greener, supporting that ethos, in the sense that we want our young people to grow up and develop and have positive outcomes living here in Powys and not living outside of Powys. So looking at that, we feel that looking at the children that we've mapped out exactly who those children are, what those next steps potentially can be. So we feel that this is realistic savings proposals in terms of identified here. And the same with the special guardianship order project, that although there is delay in that special guardianship order project being implemented, it is at the stage now of implementation. And again, this is very much about looking at children's individual circumstances and looking at where we can create a different permanency plan. And what I mean by that is where we don't actually have to be corporate parents. So where we don't need to have a specific care order to share parental responsibility with a family, maybe we could look at auntie or uncle or whoever the connected person is and say, actually, a special guardianship order would be much more suitable for this child. It means they then don't have the status of a child looked after. They don't need to have the stigma that sometimes is associated with that. And they can have that permanency plan living within a family situation or a connected person with a different order, still sharing the parental responsibility with the parents, but that care plan is in a very different way. And again, we feel that's a realistic savings proposal based on children and young people that we've identified and reflected upon for next steps in that way. In terms of staffing, we have our Grow Our Own programme, and we're very much striving to reduce our agency social workers, despite there being a national shortage. And we're kind of looking at how we can grow and develop our own staff to go on to the social work degree programme and then actually have permanent positions here in the workforce. Because for me, that is very much about sustainability. That is about now, but that's also about looking forwards. And we've been successful in recruiting wellbeing workers, and a lot of those wellbeing workers are now partaking in the degree program. So we've got a rolling program over the next 3 to 5 years, developing different staff members on that degree program. Unfortunately, we haven't hit the target of what was kind of set for this year, which I'll come on to when we look at that savings area. But certainly going forward, the trajectory is looking more positive, and it's looking, we have 7 staff that are going to be qualifying this year. We had 5 this last year, and certainly the following year there is another 7 that are going to be qualifying. So that kind of really contributes really to building that stable workforce, and obviously then we can support and grow those staff, and hopefully they will stay with us for many, many years to come. In terms of the saving around staff and expenses, we feel that we can kind of meet that target just really by doing a lot more meetings online, not having to travel to and around offices unnecessarily, and through our hybrid working. Another area of savings for us really is looking at the third sector. So we are one of the biggest contributors to the adoption service in Mid and West Wales. So we've looked at that budget with a kind of fine-tooth comb really, and feel that's an achievable recommendation. Also with the therapy, we have a new therapeutic team that has actually been secured through the Regional Partnership Board. So money was kind of obtained as a grant through them, and in conjunction with Powys Teaching Health Board, that money has been used to set up a new therapeutic provision. So they're in the process of implementing that plan now, and so hopefully over this next year that we will be able to save that money realistically, and I'm hoping that in the future, once that team is up and running, that we can possibly look at further savings in respect of that, because we'll have a therapeutic team that's actually up and operating here in Powys. So looking at using additional grant monies in a different way, we constantly get grant money that comes in periodically over the year. Some of that we know about, some of that we don't. So it's very much kind of looking at, can we use that in a different way? Can we be innovative in a different way? Can we use actually that grant money to kind of look at positions to develop pieces of work rather than actually using that out of our base budget? So it's kind of looking at just being more creative with the use of that money. With young carers, again, this is a third-party contract, so there is some savings that we've put forward here. This is to kind of go back to the baseline of what we were giving and providing to young carers pre-COVID pandemic. So there was an increase in money that was provided to young carers, and we've put this forward as a savings, which takes it back to what the original amount was that we provided. It's the same with Vouder SV. We again looked at that contract. We've looked at what do Vouder SV offer in terms of that training, and we've put forward this saving in terms of looking at the training being delivered in a different way. And then finally, it's about staff and transformation. So we are constantly looking at what can we do differently, how can we kind of move forwards to a more sustainable future. And currently we are looking at 3 posts which were vacant, which we've currently frozen, and we're going to look at that as our part of our transformation and service redesign over, well, we've started that already, and we're very much looking at that for this next year, so that we can kind of come forward into 2024 with a different way, hopefully, of working in the way in which we're providing things. So this slide is about undelivered savings. So it is as it is really in terms of what's put here. So we recognise that we haven't delivered this. We have assessed every child who's a child looked after, and we have looked at every child that was eligible for continuing care. So I can assure you that we have done that in terms of looking at all the specific eligibility criteria, all the specific information in respect to those children, but unfortunately we're not able to deliver the savings in respect of that was put forward from last year. And then in terms of our Grow Our Own, we haven't, as I said previously, with the national shortage of social workers, although we've recruited newly qualified social workers and we've actually recruited other social workers, certainly over the first part of this year, because this has actually really slowed down now. There was a quite higher leaver rate at the beginning of this year. That has slowed down. So I'm really hopeful for the future that we'll be able to slow that down further and build our Grow Our Own. And that kind of relates also to converting agency workers to permanent permanent social workers. That's a real challenge for us when we're having to compete against very high agency rates of pay. But nevertheless, I am hopeful about that for the future, because I think that staff are beginning to think about maybe putting down permanent routes, maybe staying within Powys, and when they can see that the vision is changing and that there's a reshape for the future, some staff have shown interest in actually remaining here in Powys. And I think that's my slides finished, Nina, I think. But I think Lynette was just going to come in, I think, at the end, just giving a little bit of a picture of the financial overspend from the beginning of the year and where we are now.
Yeah, okay, thank you, Sharon. Hi, Lynette.
Thank you, Chair. I just wanted to make you aware that as Sharon's ably gone through where everything is in terms of children's services, the fact that we have been through everything with a fine-tooth comb to look at proposing this budget today and bringing it to scrutiny. And just to mention, really, in terms of the undelivered savings, which we know will be, they are a concern to everyone, is that, you know, at Q1 position, we were at 3.5 million, and that has been reduced over the time that Sharon has been involved in looking at this budget. So at this point, I just wanted to say that they have been looking at everything, and that position has got, you know, a significantly a better position than at Q1 to now the current position at Q3. I just wanted to make that point. And there's further ongoing work as well. We're still working on how we look at doing things and making those savings going forward. So I just wanted to make that point. Thank you, Chair.
Thanks, Lynette. Right, it's over to us now as members. Thank you very much, Sharon, Lynette and Sue, for introducing. I'm really grateful for you structuring the presentation in that way. I appreciate that I've dictated how I'd like to structure this meeting, and you followed that, and that's really helped with our areas of focus. So first of all, I think we probably will want to look at the pressures and ask some questions around those. Members, if you could put your hands up if you've got any questions on pressures. I know I've got a few from the pre-meeting, which I'm just gonna jump straight into. Some of them are kind of like smaller, but just clarification type questions, and others are, I think, you know, maybe we need a bit more detail from you on as to how you've got to where you've got to. I can't see any hands yet from members, so I'll go first. Firstly, in relation to the 418,000 pressures that you've identified with the unaccompanied asylum-seeking children, we had a brief chat about this in the pre-meeting, and I think it's something that it would be helpful for all members to kind of understand a little bit more about our role and responsibilities in this area. But my question is whether or not there is any specific funding that comes from either UK government or Welsh government in relation to unaccompanied asylum-seeking children, either in terms of their social support that they need, or does it go directly in terms of their education support that they need? I had expected that there would be some grant type funding historically. I don't know whether that still exists or not, but I just wondered if there's any more information you can give on that, please. Or are we expected to absorb the whole pressure ourselves?
No, hello, Chair. Jackie might be able to give you the absolute specifics of what we get from Welsh Government. We do get a sum of money. Jackie, I don't know if you know that detail straight away, or if that's something you need to just clarify, but we do actually get some provision from Welsh Government. It doesn't actually cover absolutely everything, but it is a small amount of money that comes per child. And then yeah, so basically the pressures then is as a result of the difference between what we get from Welsh Government and the circumstances of each individual child. So that very much depends on when the child arrives here, and they're assessed as to then what the complexity of their needs are. So some young people may not have, they might have very little needs, but others may have significant trauma. They may have more complexity in terms of their their presentation, and they quite often may not have to be able to access education or school right then. There's lots of competing kind of challenges around language barriers. Some young people don't speak English at all, and so there's lots of work that kind of gets undertaken using interpreters about just understanding that individual young person's needs when they arrive, and then trying to match a kind of care plan based on those needs in terms of what they are. There are specific entitlements and there are specific roles and responsibilities that we adhere to as part of the young person being a looked after child. But in terms of the financial element we get doesn't actually match the level of need that we actually need in terms of the budget.
And do you get any contributions from other organisations if you've done the assessment and it's, for example, a child that has specific health needs?
That would then very much determine, we'd have to speak to that, wherever that child is placed, that health provider in that particular area, and very much have the same sort of care plan that you would for any other child that's looked after in terms of working with agencies wherever that child is placed. So yes, you would get contribution from elsewhere.
Okay, thank you. I can see Lynette's got her hand up.
I just wanted to say that, as Sharon said earlier, around this pressure, we have been looking at different ways of addressing this issue. So originally the plan was and has been that the children are placed in London for the reasons that Sharon said. But of course, our workers need to travel to London to visit the children, etc. So we are, and Sharon has already been making links across Wales to see perhaps alternative ways to address the pressure. Thank you.
Thank you. I can't see any other hands from members yet, so I'll move on to my next question to do with pressures. The 865,000 in relation to the sort of cumulative net position of placement costs. Obviously, that's a huge chunk of it, and it would be good, I think, just to get a bit more information as to the specific areas of that chunk and where the pressures are. Is it because placements are breaking down? You know, generally, if you look at our looked after numbers, they are fairly stable. So where we are seeing cost reductions when children move on at 18. So where are the outliers within that chunk? And it obviously, inflationary uplifts have been accounted for elsewhere in relation to the other pressures. So can you give a bit more detail on how you've kind of calculated this cumulative net figure?
So what we've done is look at children over this last year and looked at where there might have been a placement breakdown or where there's been a change in circumstances. So by that, I mean, if you have a child that's particularly challenging and they might have been on one-to-one support at the start, but then there might have been emerging complications in terms of their presentation, and they may then require 2-to-1 staff or sometimes 3-to-1 staff. That isn't uncommon. It's not very common, but it isn't uncommon. And we then obviously have escalating costs around that. And some of those ongoing costs are things you can't actually predict at any particular juncture. So what we've done in terms of estimating this particular figure is just look at our trends over the last year for our children looked after, and then mapped out where we think it might be more complicated for ongoing pressures over this year. So it's based on kind of real individual situations, based on what we think, looking at our children, what might happen in terms of an ongoing pressure, and then kind of looking at the trends really from previous years into this year and kind of trying to be realistic about that figure. But it's mainly due to where there's a placement breakdown, where there's a change in circumstances, where maybe there's a child with complex needs that we weren't aware of that might come to our attention. So kind of building it, those kind of areas of trying to predict that as best we possibly can.
So in last year's budget, we saw extra money go in to resource to try and help prevent placement breakdowns. Do we think that's had an impact?
I think it definitely has an impact, but I think there's still a lot more that we can do. So we do have rising costs within our residential care settings, and they have a captive market because placements are really scarce. So sometimes then they can increase their charges, and actually sometimes there's not much we can do about that if we don't have alternative arrangements to accommodate those children. And that's why it's really important that our Closer to Home board really scrutinises all those children, how much that costs, can we do things in a different way, could we increase support here to reduce this over here, can we look at bringing children further back to home. So we've mapped out all our high cost young people and children, so we know exactly where children are, what service they're receiving, what the cost is in terms of that. But coupled with that, we're also looking at how we can reduce that and do things differently in a different way, because we recognise that, you know, if we can make savings around high cost residential provision, etc., by developing our own in-house residential provision or alternatives, then actually that has a big impact then on the overall budgetary figure.
Okay, thank you. I think as a committee, it's quite a difficult area for us to be able to understand the specifics of this whilst we're looking at, you know, the wider budget. What I'd like, please, Sharon, is for when we come to look at Q1 in the next financial year, when you bring the financial position for Q1, can we have this as a targeted area to see how it's playing out and how your predictions for this year are going, and look at it then in each quarter. So yeah. I think also to aid our own understanding, but also you know, I think give us a sense check on whether your predictions are as we would expect them as well.
Yeah, no problem at all, Chair, that's absolutely fine. Thank
you. Still can't see any questions from the others. I know that everyone's got lots of questions on pressures, so I'll just crack on with my last couple of questions on, sorry, people have got questions on efficiencies. I'll crack on with my last couple of questions on pressures. The 153k to do with developing a residential home and also use of emergency accommodation, and this is instead of us using unregulated placements or holiday accommodation. Presumably those two pressures come with an associated cost efficiency, because unregulated placements are expensive, as are holiday accommodations. Is there a separate budget line in the reductions that sit alongside those two pressures? Because I would have thought over the year, although it is a pressure to get that residential home set up, presumably we're saving money in the long run here, because it's still not as expensive as a holiday cottage.
Yeah, I mean, that's an interesting question, Chair. I think you will see from our savings what we've put forward there, which is looking at our Closer to Home and our provision, etc., and how we want to do that. And then on the other hand, we have our pressures. And, you know, it's difficult to quantify, because you can't, it doesn't always necessarily mean a saving in terms of doing something in a different way. Our residential provision right now is quite costly, and it's costing us more in terms of having that particular accommodation, because we're having to rely on agency staff currently, but nevertheless we are looking at reducing that overspend by looking at recruitment permanent staff, and we certainly made some differences over December, January in terms of recruiting to our residential homes by doing something very different in terms of job fairs out and about in the community, and that has generated a lot more interest. So it's kind of a balancing act, really, in the sense of the budget. On one hand, you know, I completely appreciate your question. It's kind of risk management and high pressures of cost on one hand, and savings on the other hand, and the two go hand in hand, and all of that is kind of looked at. But it doesn't necessarily mean that if you, say, didn't have a holiday let of an unregulated provision, that it might be a saving on the other hand, because it actually might cost more in a residential provider than it would be if you had that young person in a holiday let. So it's like a kind of two balancing scales, really, in terms of that.
Okay, I appreciate it's quite a crude way of questioning it, but I presume then it's kind of on that crude level. What you're saying is that it's part of the wider transformation.
Yeah,
strategy.
absolutely.
Okay, Councillor Gareth Jones, you've got a question.
Yeah, just going back to the unaccompanied asylum seekers, I think Sharon said there's 13 children placed that we're in care of at the moment, going up to 20. How certain are you that that increase is going to happen in 23-24?
Pretty certain. We seem to be, we started off having quite a low number of 3 or 4, and then over the autumn we've gone from 7 to 13 quite quickly.
Okay.
So what we're tending to get a new referral about every fortnight currently. So I'm pretty confident that we will reach 20 quite soon, if not even before April, but certainly into April.
Okay, right. And a totally different question. When we did the Q2 review of the budget, there was a significant overspend shown on Abanai, the residential placement in Brecon.
Gareth, I'm just going to stop you there because we're going to come on to pressures in a second. Sorry, onto reductions in a second. Is that
no? This is this is a pressure.
Sorry, I've got myself confused. Yeah, no, go for it, Gareth.
But I don't think there's. I couldn't pick up you put anything in the pressures for 23-24 around Abanai. I'm just wondering why.
That we haven't done that specifically, but it is in the overall pressures as a whole in terms of our residential provision. I don't know.
So you've taken account of it in that.
Yeah,
so,
yeah.
Okay, that's fine.
So where does it in the Appendix F then? Can you just point us to that line where that would come?
I might need Jackie's help to guide me to that specifically.
Do you want me to leave that with you for
okay?
for
Yeah,
thank
you.
It would be under the placements, but we are obviously hoping that because of the recruitments, that the reliance on agency is going to be reduced as well.
Yeah, so what we're doing is tracking all those vacant positions and kind of mapping them out. So the trajectory at the beginning of the year was something like 9 or 10 vacant positions in Banai, and we've just recruited some new staff in the last week or so, and it's down to 6 vacancies. So we're hoping that we'll just continue on that trajectory in terms of recruitment to those positions.
Okay, so would that be in G and H then, Jackie, in that in Appendix F under placements, under contract inflation, or?
So it would be more part of the A and B at the top, because they're actual placements.
Okay, so the full year effect.
Yes, yeah.
Okay, happy with that, Gareth?
Yeah.
Okay, sorry about getting my wires crossed on that one. I just can't understand my own notes. Members, have you got any other questions on pressures? No. Okay, we're going to go on to cost efficiencies reductions then for children and the 2.8 million that you've got planned. I know members have got lots of questions on this. I know Councillor Liz has, and others. Just to ask you a really general question on this. In previous budgets, your cost efficiencies have come with a RAG rating, and we haven't had that this year. On a general level, I'd like to ask, how come we haven't given RAG ratings to cost reductions this year? And given that, could you just give an overview of where you think the biggest risk is in undelivering for savings that might not be delivered? And can you give any kind of assurance that, you know, maybe that this, where you're going this year, potentially is more realistic than last year?
So my view, Chair, is this is a really realistic budget. I think everything that we've put forward as savings is achievable, providing that trajectory kind of follows through. So there are some things that are easier to achieve than others. Obviously, for example, the therapeutic budget and use of grants in a different way, those are much easier to achieve than possibly the closer to home and the 16+ provision. But what we've done is kind of looked at and mapped out all those children and young people where we can be realistically confident that providing the trajectory remains in the same way in which we intend and anticipate it to be, there is no reason why we couldn't reach those savings targets. And particularly with the SGO and adoption part as well, you know, those things we feel are realistic and they're achievable, and they're based on evidence that we've got in terms of scrutinising each of our children looked after and what their journey is and what their next step is.
Okay, thank you. Councillor Gareth.
Yeah, just linked to that question then that you just answered, Sharon. If they're mainly realistic, if you were to be asked to find another 500,000, would that be achievable? And what sort of level would that be? How on a RAG rate, what RAG rate would you give any other savings you would have to put forward?
I think if there are other savings put forward, I'd have to go back to the drawing board. I'd have to look and scrutinise every single budget line again to see whether or not that was achievable or not. So I wouldn't be able to answer your question specifically right now because I'd have to go back and scrutinise that. So I think that's really difficult. But what I can say is the savings that we have put forward are realistic and achievable. And I think, you know, we can do that.
That was my perception when you gave us, Amanda and I, a briefing as chair and vice chair. No, I thought that was a really realistic set of projected savings.
Jane and Sandra, you've got your hands up. Do you want to come back on these points?
Just
go on, Jane,
sorry, it's just on that point. I think any expectation on any service to try and come up with further savings at this point in time, only a couple of months from the start of a financial year, I'd have to question how robust that would be in terms of a budget proposal. Pointing that out.
I agree that, Jane.
I think, Jane, our wider question though is, you know, we're trying to make sure that this is ambitious as well as realistic.
Yeah,
so,
absolutely, which is fine.
Councillor Sandra?
Thank you, Madam Chair. Just to reiterate really what Jane was just said, I know that the staff have been really going through everything by line to ensure that they are trying to save as much as possible. I mean, when Councillor Sue and I first heard regarding how much deficit there was in the budget, our eyes watered and we thought, well, how are we going to get out of this? But within weeks, the staff had spent hours timelessly going through it, and they had identified other ways of working and how to reduce it. But one of the things that they have done is being realistic in saying that there are some things that are not achievable, and they have named and put these forward here for us to all be aware. It's something that Councillor Sue, I and the staff are not content with. We will be keeping an eye on it, and we will be looking at how we can reduce that further. But it's being realistic because no one's got a crystal ball. We don't know if a youngster is going to turn up on our doorsteps at any time. And if a youngster were to come to us, we will not be saying we haven't got the budget to support you. We will be looking at how we can support that youngster because that's our duty. As corporate parents, we all have to do that. So thank you.
And I don't think any of us would disagree with that, Councillor. Councillor Liz, I know in our pre-meeting you had a question to do with the cost reductions in the third sector savings. Just as you get ready to ask that question, can I just ask Jane a quick question about how come we haven't got RAG ratings this year?
You can. I'm not sure I know the answer to that, why we didn't do it this year. We did, as you rightly say, last year, but we just haven't included that this time.
Okay. Well, because we will ask the questions there about the risk then based on that, because it's good for us to know. Or yeah, I don't see what difference it makes in terms of you saying it or it being green, amber or red, as long as we know. Councillor Liz, I can't see you've got your hand up, but I know.
No, I'm trying to find my hand, but
sorry.
I shall speak anyway, shall I?
Yeah.
Yeah, so my question is about utilising additional funding, and I think Sharon, you did explain that £200,000 will be removed from the base budget on the basis that throughout the year applications will be made for grants to backfill that sum of money. I think, you know, for the public, there's always a concern when you say that you're taking money out, you know, the base budget, because there's a view that, you know, maybe jobs will be lost, there'll be uncertainty, and, you know, lack of continuity of services. So if you could give an idea of, you know, whether or not you are thinking of removing posts, or whether you're thinking of identifying specific areas of service that you want to obtain funding for. But I think it'd be really helpful for people to have a kind of grasp of how you take that money away and then you replace it, you know, throughout the year without sort of having gaps and, you know, difficulties.
Yeah, no, thank you, Councillor. So it's more about looking at transformation and looking at reshaping children's services. So there isn't an intention today, right now, to kind of look at preventing posts or removing posts, etc. It's more about giving us an opportunity to be a little bit more innovative. So by that I mean, I'll give you an example of we are looking to develop services around babies and preventing babies coming into care. So it gives an opportunity to kind of maybe look at posts in a different way, but also look at funding in a different way. So we invariably get pockets of funding at different times. So it's kind of using that to be a little bit more innovative and creative. And maybe there are short pieces of work that we need to do where we need to bring somebody in specifically to do something in order to develop something to then take it forward. So it's more about transforming and being sort of innovative rather than removing posts.
Okay. I guess all I think, you know, in that regard is, you know, usually if it is a specific area of transformation, there'll be some kind of description of what will be achieved and what will be done. So I think, you know, it still does just sound a little bit vague, but, you know, I kind of take the point that the £200,000 will be saved through transformation.
Okay.
Thank you.
I think, Liz, perhaps again, when we come to look at Q1, if we get a good update on the transformation projects as well, it will help us see, you know, what's on track with all of this.
Yeah, thank you, Sharon.
Any other questions from members on cost efficiencies and reductions in children's? I've got one more. Oh, hang on, I can see a hand up. Councillor Chris.
Thank you, Chair. Thank you for the presentation. I think it's been really helpful and enlightening, particularly around some of the complexities of the service that you provide. I welcome that you've got the new staffing model around growing your own. I think that's sensible, and I've seen that work elsewhere. But I just wanted to know really about the attrition rates of that provision. Are you seeing any attrition from it? Are people dropping out? Because some of the assumptions then of those savings may not then be realised if you don't have those workforce numbers coming through. Is there any ambition to increase those numbers going forward? And does that then reduce the cost efficiencies within that budget line because of the cost of the training provision that needs to be provided?
Thanks, Chris. I also had a question on this area. So just whilst officers think about that, I'd like to add to Chris's point that obviously growing our own was something in last year's budget that wasn't fully achieved. Sharon has mentioned that she is a bit more hopeful this year. So as part of answering Chris's questions, can you just sort of give a view also on how are we doing more than we did last year in order to incentivize and encourage the students within this cohort to stay with us? What specifics are we doing there?
Can I add a bit too on that, please, Chair?
Yeah, absolutely.
It's just
Then
that
they can answer it all together.
Yeah, I think it's probably better altogether. It's just that I picked up in the impact assessment on this, it said that there were 10 people qualifying in November, but in the presentation from Sharon it said 7. So I just wondered what the number is and whether that is to do with attrition. Thank you, Chair. I'll lower my hand.
Thanks, Chris and Liz. Over to you, Sharon.
Yeah, you're absolutely right, Councillor Liz. It was a projected figure of 10 for this year. And then when I spoke to one of our senior managers that leads on this, there's been a change in a couple of people's individual circumstances. So they're not actually leaving the course per se. They're having to defer for another year, some due to personal circumstances and one due to just not hitting the standard for the level of the course at that particular time. So in terms of previous years, we were the 5 that qualified last year were 5 people that were seconded and 5 people that qualified. So I guess our success rates are really good based on last year. I think going forward for this year, out of the 10, it has dropped down to 7, but that is a realistic 7 in terms of going forwards, unless of course circumstances change beyond any of our control. So right now it is certainly 7 that are kind of due to qualify. One thing that we've done differently over this last year, we've also developed all those students that I just talked about have come through the Open University route, but we've also opened up the opportunity to look at master's students. So this year we actually sponsored 2 students from Cardiff University that weren't from Powys, that have come into Powys doing their placements here, and both of them who are going to qualify in the summer are intending to stay on with us. So we did it as a kind of trial to see if it would work in doing it in a different way, and it certainly was successful. And we do have other staff within the authority who've already got degrees who then are eligible to apply for the master's course. So we had something like 10 applications for 2 places for this year. So that kind of tells us that actually there is a cohort of people that we could look at doing something differently. And we've certainly offered another 2 students those placements via Cardiff University for this following year. And in terms of just the supportive element, I'm sure you'll all appreciate that kind of working online and working in this way is sometimes really challenging when you kind of want to have a conversation with someone and somebody might not be available when you're ringing them. Whereas if you're in an office or if you're kind of having that support on a kind of face-to-face level, then the support for you as a student or as a newly qualified social worker is absolutely invaluable. So we've just made this decision in the last week to kind of move our staff back into offices for 2 days a week to kind of create that kind of culture of support in terms of being around people, having conversations, being there for our students, being there for our newly qualified social workers. We're also looking at developing a post which is going to come out of a grant pot of money to start off with, and if that works then we can look at developing that further, and that is what we call a practitioner that is assigned to specifically supporting newly qualified staff. And by having that person just be in there just enables that person to ask any question they want. They can have the support at any particular time they want, and just building more support around the workforce, because we recognize that some teams have a lot of constraints. Some teams we do still have higher agency workers than we would like, and we really want to kind of create that kind of culture of learning, that culture of support, and kind of really assist and develop on our grow our own. So it's much more really than just offering the student a placement. It's kind of looking at when they qualify, where do they work, how we can build in the support mechanism for them over the years to come, because we want them to stay in Powys once they've trained with us. So I hope that kind of answers the differing combinations of questions that were put forward.
Chris, are you happy with that?
Yeah, I mean, I think it's something that you have to factor in whenever you're going to do training. There's always going to be changes of circumstances. So I'm glad that that's
We're having a few connection problems with your internet,
on board. On the slightly concerned. Sorry, I'll just knock my camera off, Chair. It might be better. The one thing that I am always concerned about, and in fact, I've had a conversation this week about grant funding being used for particular posts because it's short term. And if that grant funding then is lost or doesn't get replaced with some other funding, it can impact, and particularly if you're going to be focusing this towards newly qualified social workers in this case, you need someone that's going to be there over the longer term. So it's just an added caution, because if that post disappears, that support package that was in place then goes, and that can actually then cause more problems within the team and that team management going forward. So just a note of caution there, but welcome the approach.
Thanks, Councillor. Councillor Gareth.
Yeah, just a couple of points on what Sharon just said. I really welcome the fact you've got staff going back in the office. You know, I deal with apprentices doing their SIP for qualification, and I met with some apprentices last week, and they've had some face-to-face training, and they were saying how much better it was face-to-face than it was online. So that's just an income. Can I just ask, when they qualify as a social worker, do they have to stay with Powys for a certain period?
Yes, so we've built in a contractual obligation for 2 years post-qualification in terms of them remaining with Powys.
Right, okay. And then a totally different question. I noticed in the adult services budget pressures that they've got a budget pressure of 490,000 for children, moving from children into adults. Is there a equivalent figure for efficiencies, and if there is, which line is that in for those to take account of that?
I'll have to come back to Jackie for the lines of where that efficiency
Well, or even if
be.
I think, Sharon, from my point of view, if you give me assurance it's there, then that's fine.
Okay.
Yes,
It is there.
it is there, and it's part of the overall where we've modelled the placements and the children moving through the system.
Thank you, Jackie.
Yeah.
Is that the 2.4 million, Jackie?
Yes, it's in the placement.
Part of it.
It's in
line.
Appendix F, Gareth, under the placements. It's
Yeah, it's included in that. Yeah, okay, that's
Yeah.
great.
yeah, it's
Yeah.
included. So Jackie's saying it's included in that. Okay.
Yeah, we take each child and follow them and model them
Run
through the
through.
system.
Okay, thank you. Right, members, has anyone else got any questions on children's? I know we have had some discussion about historically in last year's budget recommendations, we did ask about children who we sort of quite crudely, I'm not sure I like the phrase, but were referred to as legacy children who are in our system, who potentially may not have been receiving the amount of services that they would have been had children's services been in a different position pre the 2017. Is that going to be covered in confidential session at the end, Jackie and Sharon?
Yes, Chair, it is.
Thank you. Okay, I will leave that one there. But just for the members of the public, that potentially, and correct me if I'm wrong, please, Sharon, does that relate to ongoing pressures within the service?
Yes, that's correct.
Okay, thank you. Right, I think we've got through it sort of about 5 minutes faster than I thought we would. So what I'd like to do is to have a quick 5-minute comfort break before we move on to adults. Thank you so much to the children's team, to Sharon for talking us through that, and Jackie. Thank you, Jackie, but I presume you're going to be staying to do the next bit as well. But yeah, thank you, Sharon and Lynette, and yeah, I know we're coming back to things at the end, but if you want to clock off for the adults, please feel free to do so. Everybody else, could you put your cameras off and your microphones on mute? We'll leave the recording going, but we will be coming back at 15:30, please, to crack on with adults.
I'll pause the
I've sent you a quick email, Chair.
Okay, I will have a look at that now as well. Thanks, everybody. I'll see you in 5. Right, we're back live. Thanks everybody, and we're ready to go to the adult social services section of the budget. I presume Michael is leading on this. Can't.
Yes,
see.
happy to lead, Chair.
Thanks, Michael. Are we covering commissioning within the same presentation?
There is a section on commissioning as well, so Rachel Evans, who's also on the call, can lead on the commissioning element, although there are some areas of the operational adult services budget that's got a commissioning element also.
Okay, and also, are there any areas of this which need to be in private session, or are they all okay in public session?
I think if we want to talk in any detail about the funding body review, I would suggest that that is in a closed session.
Okay. What about efficiencies to do with Shore Trust homes and savings on other areas like that? Perhaps if we get, I know we've got a couple of questions to see, perhaps if you think that it's going to be something that needs to be in private session, then we can just park it for.
Sure.
Okay, right, well, thank you. Thanks for coming to Scrutiny, Michael, and welcome to you and to Rachel. I don't know whether Councillor Shan going to say anything at the outset or after your presentation?
I prepared a sort of an overview for the end to pick up on main themes and challenges, risks and opportunities, but I'm happy to introduce the next part briefly. And I would really just like to say huge thanks to all the officers involved in this, and to remind people that our officers in adult social care have been working on this at a time of inordinate pressure, winter pressures, and intense daily partnership work with the NHS to manage those huge pressures coming through hospitals. You know, immense and sincere thanks to them for all the hard work at this really difficult time.
Thanks, Shan. I think if we do the presentation, and if there's anything that you want to add that hasn't been said, I'll invite you to speak. It's 15:33 now. I'd really like to start questioning on this area by 4 o'clock, if that's possible. So if you could aim for that, that would be fantastic. And over to you, Michael.
Thank you, Chair. So today I'd like to take you through the adult services pressures and the savings that we've proposed to mitigate these pressures as far as possible. Just in terms of some highlight figures, we've calculated service-specific pressures of £8.26 million. Should be noted that 90% of those pressures are attributed to contractual provider uplifts, and really what that represents is the increased costs of delivering good quality care and support for residents that require it under the current economic circumstances. And we've got an additional £980,000 of pressures that are associated with COVID and the conflict in Ukraine. The savings that we're proposing are just over 6.4% of the baseline budget, and we're offering around 29% of the overall savings that's being provided across the council for 23-24. Before I go into the detail, I just want to give a brief overview as to where adult services is at the moment, just to place these proposed savings in context. So first of all, we continue to look to support adults in Powys to live the best life we can. We focus on what matters. We work alongside people to help them find the right solutions for themselves. As Councillor Shan has just said, we have been working incredibly hard on this budget in the context of having invoked business continuity once again last December, and that's due to the significant levels of demand for adult services and the increased difficulty in our ability to respond at this point in time. That's both in terms of assessing for and reviewing care and support, but also in terms of being able to match eligible care and support needs with timely and suitable provision. This situation has been compounded by the high numbers of people across Powys and in cross-border hospitals who require ongoing care and support following a stay in hospital. I think given all that context and also the national shortage of qualified staff, and the continued cost of living increases, this is the most difficult budget setting process that Adult Services has undertaken in a long time. So what's guided us has really been our ongoing vision for the service, and we've also been guided by our ongoing demand management objectives that you can see in front of you just now. And that takes us through the whole spectrum of care and support, starting at the front door through to looking at creative and efficient ways of managing demand from hospitals and in communities, and when it comes to the provision of long-term care. The budget that we'll go through today in terms of savings in many ways represent a continuity of previous year's efficiencies. And those efficiencies in turn are linked to the ongoing transformation of how we want to work and what we want to deliver within Adult Services. So despite the challenges, I think as far as possible, we've tried to remain committed to having a strength-based budget for Adult Services. If we can move on to the next slide, please. Lovely. Before I pass over to Jackie Pugh, who will just give us a brief overview of this slide, I just wanted to take the opportunity before we move on to thank all of our staff across Adult Services, both internal and commissioned providers, for continuing to work under such a sustained period of demand. I'll pass over to Jackie briefly, and then I'll return to talk about the pressures in more detail.
Thank you. As you can see, the current base budget for adult social care is 73,938. The additional pressure for the pay award in relation to this financial year is 652 because it wasn't in the base budget. Then there's the pressure of the pay award estimated at 3% for 23-24. Then the inflationary uplift for non-pay for 23-24, which is 154,000, and that's in general 2%, but there are anomalies of 10% for food, 32% for fuel, and then the different amounts for electric, gas and oil. And as a lot of the services within adult social care are provided externally, those provider pressures will be in the 8260 million. So demography of 491, which will be on a future slide. The pressures of 8260 are the totality, but in the main provider uplifts, and will be discussed on a further slide. The COVID pressures are 980k, and they're amounts that were being funded from the COVID hardship in 21-22. They're in relation to amounts that were carried forward from last year's underspends or grants to utilise in this year, but are still required in the budget. So that's 980k. Savings, a total of 4768, which will be on a future slide, given the request total of 80,303,000, and that's a variance of 6365, which is a 8.6% increase. Thank you.
Thank you, Jackie. So first of all, just briefly want to talk about the growth demography that's in the adult services budget. We've got just over 490,000 associated with the known list of individuals who will be transitioning from children's services to adult services in the next financial year. We know that 15 people will be transitioning to adult services. We work very closely with children's services far in advance of individuals turning 18 to get a really good ongoing understanding of the needs of that child, and then determining what their needs may be when they move into adult services. And it's on the basis of that analysis that we've costed that 490,000. We go on to the next slide, please. Okay, so in terms of service-specific pressures, what we've tried to do here is split it into 4 categories. The first category you can see here is demography, held at risk and managed via the risk reserve. This was a pressure, a demographic pressure that materialised this financial year that was managed via the risk reserve. What we're doing here is recording that pressure that we're seeing this year and making sure that we incorporate it into the baseline as an ongoing pressure for future financial years. It should be noted, however, that we do look to contain those pressures as far as possible through the likes of right-sizing care and support plans, aided by technology-enabled care and other forms of community equipment. The next theme is those pressures, demographic pressures, that were not in the forecast outturn. This is essentially the full year effect of this financial year in terms of new people coming into the care system. So in other words, that's the full year effect of the £500,000 pressure above. And then the third service specific pressure is about the contractual provider uplifts. And that's on a per contract basis, and also due to the Welsh Government mandate of the real living wage, which in itself accounts for £4.4 million. And just to provide a little bit more detail as to what these uplift costs cover, first of all, it's based on the real living wage, as well as any additional increases regarding food costs. It's also related to the increase in the rate that we pay per hour for domiciliary care that accounts for the increase in the real living wage, mileage reimbursements, and ensuring that we reach the ceiling price of the UK Home Care Association rate, and that's in line with our previously agreed valuing domiciliary care strategy. It's also in relation to the increase in the rate that we pay supported living providers, again, based on real living wage and RPI increases. And then it's about an increase in all other contract uplifts in respect of real living wage. That covers direct payment packages, external older people's daycare, external day and employment opportunities, community equipment services, extra care, respite, and shared lives. The fourth item here is what we've called backfilling for approved mental health practitioners training. Essentially, this is about staffing, recruitment, and sustainability. We find it really difficult in Powys to recruit to approved mental health practitioners, and AMPs are responsible for organising, coordinating, and contributing to Mental Health Act assessments, and ultimately determining whether somebody should be detained under the Mental Health Act. So we need to make sure that when we're encouraging staff to go on training in order to become AMPs, we're able to backfill those substantive roles so that we can maintain our ability to deliver this statutory function. If we move on to the next slide, please. So the next slide is in relation to, again, pressures, but COVID and Ukraine specific pressures. These pressures have materialised, and they're currently being claimed from the Council's COVID risk reserves or other reserves. The first one here is again about approved mental health practitioners. I just mentioned what the statutory role is for AMPs, and what we have seen is an increase in mental health referrals during the pandemic, and that increase has remained. AMP provision, as I said, is a resource that's in short supply across Powys, and we've been claiming from the hardship fund for these posts, which will be ceasing, and therefore these posts require recurrent funding, and so it's our recommendation that these are funded going forward. Similarly, moving on to B, which is about the older social work team, we've seen sustained high levels of demand for older people services at our front door, and we've got a responsibility under the Social Services and Wellbeing Act to assess and arrange care and support for these people should they have eligible needs. Those posts were funded through the COVID-19 reserve. Again, we want to make sure that we can continue to fund those posts going forward. Coming back to the recruitment and retention issues that I was mentioning previously, we know that one of the reasons social workers leave our profession is because of unsustainable and unsafe caseloads. So we need to do all we can as an authority to address this increase in demand with a level of resource that can match it, so that we can maintain that strength-based approach and support our staff. Moving on to the next item, this is about our hospital social work team. Again, 3 social workers have been funded via the Council's COVID-19 reserve to meet demands and pressures from hospital. You'll be aware that the pressures from hospital remains exceptionally high, and without adequate resource to understand the ongoing care and support needs of those individuals at the point that they're medically fit for transfer, people will be delayed from leaving hospital, which we want to guard against, because that can lead to deconditioning and ultimately more costs for the overall health and care system. Loss of income due to the pandemic, that was based on what was being claimed previously through the hardship fund. External providers increase in travel, that's fairly self-explanatory. There was a recent cabinet report back in 2022 which agreed that we should be paying providers an additional 10 pence per mile mileage reimbursement rate, given A, the cost of living crisis, and B, so that it was aligned with the mileage reimbursement that we pay our own internal staff. The last COVID pressure that you can see in the table in front of you is about increase in costs associated with the recommissioning of some contracts. I won't go into detail of the contracts this afternoon due to commercial sensitivities, but what I can say is it's related to supported living and extra care. And that's how we've come up with that pressure there, which gets us to the overall 980,064, as Jackie mentioned in the previous slide. That's it in terms of the pressures at this point in time. Chair, would you like to stop for questions at this point, or are you happy for me to move on to the savings?
I think if you crack on, and we'll then do our questioning all together, but we will question it in this order.
Sure. Okay, so if we move on to the savings in that case, Adult Services is offering just over 4.76 million of savings for 23-24, and the service will not be carrying over any undelivered savings from 22-23 because we're on track to achieving the savings target that we set ourselves in the previous budget round. Before I go into this in a little more detail, just to make the point that a great deal of our savings proposals really represent a continuation of our ongoing transformation work across our services. And by transformation, what I mean is our ongoing endeavours in designing new ways of working that are affordable and that change and replace what we do rather than adding extra permanent service layers to what we do already. Given the increased challenges associated with balancing the budget for 23-24, we're also proposing a number of savings that remove non-statutory provision. We believe, however, that the savings we've offered up under that theme are achievable and that they won't compromise quality and consistency of care. And I'll come on to discuss that shortly. The third theme is about recommissioning and decommissioning, and that's about the work that we're proposing to do to achieve greater value through our contracts. And the final savings theme is about additional opportunities for income generation. So if I start with transformation first of all, which you can see on the slide in front of you. First of all, we wanted to account for the full year effect of part year savings from this financial year. And this is in relation to ongoing work around promotion of direct payments, supporting people to move into more independent living and out of county placements, and the ongoing strength-based review work. Essentially, this is work that's already underway, but the full year effect will be achieved as we move into 23-24. The second item here is about direct payments. Analysis suggests that there is a difference per hour between a direct payment rate and a commissioned home care rate. And that's because there's fewer overheads for direct payments compared to a commissioned provider rate. So when we promote direct payments as an alternative to a commission provider, there is an efficiency that we can achieve as a result. We're confident that we can achieve that efficiency. We have done in previous years. Where people live, this is about our ongoing approach to support people, particularly people with learning disabilities, to move back into Powys or to move closer to Powys, out of expensive out-of-county placements and into more independent supported living options. That ultimately means a reduction in the number of people who live in care homes and specialist homes outside of Powys, and there are efficiencies that we can gain as a result of that. This is very much part of the ongoing transformation of learning disabilities, and it's already proven to generate efficiencies in previous financial years. It does rely on much collaborative working with the local health board and other healthcare and housing partners, but we do have a robust programme of work in place that allows us to continue with that. Funding body review, we can discuss in detail further in a closed session if need be. It is about ensuring, however, that care is being delivered and funded correctly with respect to the legal thresholds set out in the Social Services and Wellbeing Act. If we can move on to the next slide, please. Okay, so the Care and Support Transformation Project, this is part of our ongoing work to manage demand through strength-based reviews in particular. The Social Services and Wellbeing Act makes clear that care and support plans should promote well-being. And so our ongoing work here is undertaking strength-based reviews to ensure that the care and support that we're providing is proportionate to eligible needs. And that will be in relation to both home-based support funded, delivered via commission providers, and also direct payments. What we found previously is that there is efficiencies that can be gained by revisiting care and support plans with a view to seeing if they can be made more strength-based with the assistance of the likes of technology-enabled care, other community equipment, and also working in partnership with occupational therapy to make sure that we are as proportionate as we need to be in terms of the delivery of that care and support. The next two items you can see here are travel efficiency and mobile phone target reduction. Again, fairly self-explanatory. We're confident that we can achieve these efficiencies given the new ways of working and the fact that we have more people who are splitting their time between work, working at home and working in the office. The Disability Day Opportunity redesign, there is a longer term piece of work here, but the efficiencies that we've offered up for 23-24 is the part year effect of stage one of that overall redesign, and that's in relation to ceasing the leases of two buildings that we no longer require. One is in Brecon, and that's in relation to a building that we were previously using for alternative sensory experiences for people with disabilities. We're able to deliver that at another setting in Brecon. The second lease is in relation to Astragon Lice day services. During COVID, the service was being delivered from our older people's day centre. It will continue at that base, and so the lease at a local youth centre will no longer be required. And it's as a result of ceasing those two leases that will achieve those part year efficiencies. Moving on to the in-house supported redesign of nighttime hours. Essentially, there was a historic interpretation of an agreement with a provider that meant that a member of staff had to sleep in the building as part of the wider care and support contract. When we have analysed the nighttime needs of the individuals in that current supported housing place, no one has nighttime needs. So therefore, we can achieve some savings by changing terms and conditions for staff who currently undertake sleep-ins at that setting. Moving on to the older people day provision review, what we propose to do in 23-24 is undertake a consultation with various stakeholders around what makes for meaningful daytime opportunities for older people. This will enable the council to better determine how we can support people to have more control over their lives and access activities in their local communities. As a result of this consultation, the council may be in a position to generate a small efficiency through reconfiguration of day opportunities provision. We do want to co-develop these opportunities with residents and communities, and so there are no detailed plans yet as to how we achieve that efficiency. We do believe, however, that there are potential efficiencies that can be made by utilising alternative day opportunity provision within the county at this point in time. But due to commercial sensitivities, that's not something that would be appropriate to discuss in this forum, although happy to discuss in a closed forum. The final one you can see on the list in front of you is advocacy. This is about non-statutory independent professional advocacy. Essentially, there is a post that we intended to fund in a provider to deliver the non-statutory advocacy element. This post, despite a number of efforts to recruit to, has not been appointed to. And so our proposal with the agreement of the provider is to reduce the current underspend within that contract by removing the post from the contract. And we're confident that that won't have any adverse effects on the overall advocacy offer for adults within POWIS. If we move on to the next slide, please. Okay, so moving on to recommissioning, decommissioning, therefore. Respite for learning disabilities. This is about our short stay houses. We commissioned 3 short stay respite houses across POWIS. One of those properties is rarely used, and the providers indicated that they would be in support of the proposal to close that house, which would save £20,000 per annum. The other £30,000 per annum is based on reconfiguring our current respite contract. The current contract is based on delivering a certain number of hours per week, and that's based on a fixed price, regardless of the actual hours delivered. From analysis, we've actually identified that in reality, the actual hours delivered do not on average exceed what is in the contract. So the proposal is to reduce the maximum delivery to therefore save the £30,000 per annum. The next item is about void management in the context of supported living and also reduction in our spot residential contracts. So a number of placements have been vacant for some time. Some shared houses have also not been fully occupied for some time. That's partly due to issues around compatibility and due to some legacy accommodation that does not meet current expectations. So the proposal here is that the council reduces the number of voids that would enable us to achieve an efficiency of 23,395. The additional £100,000 is achievable by incorporating better use of the older people's care homes contract and through reduction in the use of spot contracting. And we believe that we can achieve efficiencies through that proposal. Okay, moving on to income generation then. First of all, income from additional clients. We've modelled on average that people in receipt of community care can be asked to contribute up to £100 per week for their care and support, in line with Welsh Government guidance. But of course, each contribution is subject to individual circumstances and a financial assessment. If it's residential, it's in relation to the level of capital and assets that that individual may have, including their disposable income. So we've tried to model on that basis, controlling for these variables to get to the £250,000 income generation. The next income generation opportunity is about increasing fees for appointee and deputyship. That's about bringing ourselves up in line with what the Office of the Public Guardian tells us we can charge for in terms of appointee and deputyship services. And that relates to charges for our banking system and charges for our property fee or management of a property. And so there's a small income generation opportunity of £27,000 there. Finally, we have 2 one-off savings, and by one-off, I mean that whilst we will achieve an efficiency in the next financial year, that won't be a recurring efficiency, so we will be requesting that that money goes back into the baseline budget in the following years. There is one-off saving attributed to the backdating of savings in regards to the funding body review, and also a one-off saving that can be attributed to the fact that there's been an underutilisation of direct payment usage due to the pandemic. And it's through all those savings themes that we get to the total of 4,767,960. Again, happy to stop there at that point for any questions on either the pressures or the savings.
Thanks, Michael. I think again, what we'll probably do is go through adults all together. I just was going to ask about commissioning. What are you planning on to do with presenting on that?
I can pass over to Rachel Evans, who will give you a brief overview of the commissioning element.
I think we'll probably pause here then now for questioning. Yeah. No, that would be, yeah, that's great. Thank you very much for the presentation, Michael. Again, thank you for following my structure as well as to how we wanted to do today. I think we're going to have lots of questions. Again, we'll split it into pressures first of all before we go on to cost efficiencies. So members, please can you start by putting your hand up firstly if you've got any questions in relation to pressures. So we've got a significant amount of pressures which are service related, and then some that are to do with COVID pressures and demography. Just to kick it off then, Michael, in relation to the COVID pressures, and I appreciate that this is broken down into some posts that need to be filled permanently going forward, but are these pressures still to do with issues like people that didn't get maybe hospital operations when they were needed during the pandemic, and so now previous health problems that could have been nipped in the bud have possibly become social type problems? Is that what we're talking about here?
Yeah, I think that would be fair to say. There is modelling from the NHS delivery unit that suggested that the tail of demand for social care is going to be longer than that of the NHS. And so what I think we're still contending with here is a legacy of individuals who didn't have necessarily the timeliest of healthcare interventions, understandably. Due to the pandemic, that has created a level of deconditioning and an escalation of need in the community, which has led to more complexity and a higher level of demand that the adult services needs to respond to. So that's why we were very keen to state that as COVID related pressures, because I think the increase in that demand is in many ways down to the legacy of COVID.
Okay, thank you. So when you then come to look at the demography type pressures of the increases in the where I think from my knowledge of this, you look at ONS data in order to look at what trajectory and numbers of the population may be coming into our service in terms of demography. How do you make sure that there's no double counting? Because perhaps some of those people that would be coming in because of COVID would be coming in anyway a year or so down the line. How do you account for that to make sure we're not counting the same person twice?
Yeah, it's a good question, and there is a level of uncertainty here in terms of the modelling, because when we produced the FRM, we didn't exactly know what new demand was going to be coming through the system. So there is an element of modelling here that we look to update on a regular basis. In terms of the actual demography, we look at Stats Wales data that allows us to understand that trajectory. In terms of the COVID-related pressures, the way I would explain this would be to say that would be additional demand over and above what we were expecting through that demographic data, which doesn't necessarily control for the legacy of COVID that I just outlined.
So the way that you're presented with that data, are you able to quite clearly see that there's a gap between there's an area between the two which isn't accounted for in demographic data?
I think we can account for that in terms of our monthly performance reporting and looking at the demand that's coming through the front door and the level of assessments that are required compared to previous financial years, which goes above and beyond what we would normally expect.
So can you give an assurance that you're comfortable that there's no doubling up of these service users then?
Yes, I can. Yeah.
Okay, thank you. Councillor Glynn, have you got a question on pressures, please?
Yeah, it doesn't pertain to COVID-19 pressures, but just around contracts with other organisations. I mean, we've seen it across the kind of across the kind of public sector, where local authorities and associated organisations have got themselves locked into contracts, which actually, given rises in inflation and energy costs, etc., become unsustainable and might be kind of characterised as kind of bad contracts. I know that, Michael, you kind of obviously stated that kind of 8.2 million service pressure was predominantly to do with the real living wage commitment. But with any other kind of those contracts with other organisations, I was just wondering, has there been a review of those contracts to and a judgment been made as to whether some of them would be designated as poor deals and poor contracts? And if so, what work is being done going forward to ensure that council taxpayers get good value for money going forward?
Yeah, I can give a fairly high-level overview, Councillor, but I'll pass over to Rachel, who might be able to offer more detail. We have a commissioning team and a contract management team, and on a day-to-day basis, they are working to get best value for money for Powys residents in terms of our contractual commitments. But clearly, we have more pressures than we accounted for in terms of the real living wage, and also the level of inflation that is a lot higher than what we would have initially accounted for. So we do have providers approaching us, asking for us to review our terms and conditions as well. There's a balance to be found, because we have a responsibility to ensure the sustainability of the market, so that we've got adequate care and provision for residents that have got those eligible needs, but we need to make sure that we're doing that in a value for money way as well. But it's not a one-off piece of work. This is the daily bread and butter of Rachel's commissioning and contract management team. But I'll pass over to Rachel, who may have more to add.
Absolutely, thank you, Michael. Yes, just to add to that, Michael's absolutely right. So in terms of undertaking assurance around contracts, we have a really robust contract management system in place. Part of that is around seeking regular financial information. So we would seek to look at the expenditure against an available budget, and to also understand whether some of those budgets are showing pressures that were unforeseen at that point of undertaking a procurement exercise. So we would routinely look at things like the cost of service, whether some of those pressures were predictable and could have been foreseen as part of the procurement process, but also whether the organisation has got a really good, robust financial process in place to be able to come within budget and manage some of those pressures. But I think one of the things that I'd really like to highlight is the fact that we've got really good relationships with organisations. We take very much a relational contracting approach, see organisations very much as partners and strategic partners in that. So we very much encourage the sharing of information, open book accounting, and being able to explore solutions together. So that's a really just an overview really of some of the approaches we undertake in terms of getting that level of assurance.
Thanks, Rachel. Councillor Glynn, are you happy with that? Are there any follow-up questions you want to ask on that?
No, I think I'm happy with that answer. Thank you.
I'm just going to ask a quick follow-up on that whilst we're on that topic of the contract provider uplifts. Within that, you mentioned inflationary pressures. Does that include care home utility bill pressures? Michael, Rachel?
Sorry, yes, it will incorporate utility pressures as well.
So have we undertaken a check to see whether or not any of those organisations received specific utility support from government? Because I seem to recall, and this may need to be checked, but I seem to recall that when the business support utility there was a fund for business utility support that came through from UK government. I think that care homes potentially were included within that. Have we done an exercise to ensure that if our care homes did get any specific government support, that they're then ensuring that that's not then part of what they're then asking for in contracts, because they've actually received you know, it might not be the full amount, but they've received a fraction of it. They're not passing on something that perhaps they have actually been covered for. Have we done an assessment to check that?
I'm happy to take. I'm happy to respond to that. So yes, part of that, part of the financial monitoring will be to get an assessment in terms of all income received by that organisation. So it wouldn't just be some of that business support. It could be any other income that would be contributing to the viability of that service. So whilst I'm not able to give a detailed answer in terms of all of our provision, the open book accounting and the analysis of that information will include all income for us to make a really good judgment around the need to provide any additional income. So essentially all of our financial uplifts will be based on financial evidence of need.
Okay, thank you. That answers my question. Councillor Chris.
Thank you, Chair, and thank you, Michael, for a very informative presentation. I think you give a lot of clarity around some of the work that's been undertaken, and I think that's welcomed. Just in relation to COVID and the pressures from COVID, have you seen any drop-off in relation to that, or is it consistent? We used to mention that we get pressures at certain times of the year, particularly in health, but usually it would then drop off and you get a recovery period, but it seems to be constant. Are you seeing that exact same? And what does that look like in relation to workload on individual practitioners?
Yeah, thank you, Councillor. I don't think we're seeing any drop off at this point in time. Just to provide some very high level figures, I can see in front of me that in terms of the number of new contacts that came through Assist, which is our front door for adult services, if we go back to December of 2021, that was just over 330 contacts. If we look at December last year, which is the latest figures I can see, it was 509, and that was actually a drop from an all-time high of 618 back in October 2022. This is creating a situation, as I said at the beginning, where the demand for social care and support, whether it be somebody requiring an assessment or somebody having been assessed that now requires provision, that is outstripping our ability to meet that demand. And for as long as that demand remains high, that gap has got the potential to increase further. And part of that is, I think, the legacy of COVID. In terms of the impact that that's having on our staff, as head of service, I'm acutely aware of the impact that it's having on staff. I check in with team managers and senior managers on a regular basis, and I think it's leading to higher than usual caseloads, which is compromising our ability to a certain extent to undertake that strength-based approach, which relies on time to build up trusted relationships with individuals to really get to grips with what matters. What I'm telling you just now is no different to what any other local authority would tell you just now in terms of adult services across Wales. And that's compounded by a national recruitment and retention crisis, which means that even though we've got vacancies, it's increasingly difficult to fill those vacancies as well. So I think in summary, the demand remains high. The impact on staff is negative, but we're doing all we can to prioritise the demand that comes through our front door in line with the prioritisation framework that we've created as a result of going into business continuity. And we're constantly thinking and acting creatively about how we can redeploy staff to business critical roles to deal with the demand that's of a most time critical nature.
Okay, thank
Happy,
you.
Chris?
Yes, I mean, I didn't expect it to be any different than anywhere else. I think it is a common feature, but I think it's important that you have highlighted it because it is a significant pressures on there, and the breakdown that you provided, I think, is really helpful going forward. Thank you.
Thanks, Chris. Gareth Jones, have you got a question on pressures?
Yeah, thank you.
Just very quickly, and perhaps this is for Jane and yourself, Michael. You mentioned earlier that some of the pressures are funded in the current year by the risk reserve. Do you know what the overall level of risk reserve is? That's one question, and I think that is for Jane. The second question, well, it's not a question, it's a point, and perhaps this is for Jane to note as well. In your pressures, you said you increased in the mileage rate up to 50p to match a county council. My understanding, that's only that the council's only increased it to 50p until the end of March. So it may well need, that one may need to drop down to 45p.
Jane?
Yeah. On the risk budget, it's not a risk reserve, it's actually a baseline budget included in the revenue budget. It's been 2 million for a couple of years, but I think this year the proposal is to increase it by 1 million because of the increased level of risk on the budget, particularly around inflation. And we haven't included all items in that base because they haven't necessarily materialised, but we felt having that 3 million or a slight increase on the 2 million did give us the coverage we needed. And if we don't spend it, obviously, it can be the first call for next year's pressures. So that's where we are with that. In terms of the 50p per mile, I think you're right in that we've only approved at this stage, I think, for our own staff. So that is something that we will have to look at, but it isn't committed to go out the door as yet.
Yeah, okay, thank you.
Thanks, Gareth. Chris, you've got your hand up. Is it?
No, it's a legacy hand. Sorry,
Legacy
Chair.
hand. Okay, I've got one final question. Oh, Jane, your hand's back up. Is that?
Sorry, Chair, I'll take it down now.
Sorry. I've got one final question on pressures, unless other councillors have got any questions. This is in relation to the 79.5k, the AMHP intensive mental health training. I understand from what you're saying that when the staff are doing that training, that pressure is because we have to cover their role, and it's quite an intensive course. I just wanted to ask a bit about that training and what benefit is it a legal requirement that we have to have staff doing that training? What benefit does it bring to us as a council? And do we retain the staff that do that training? Because anecdotally, I think it's quite an attractive, once you've got that course, it's quite an attractive qualification to go on and work elsewhere, such as at health boards. So I just wondered, if you could just give a bit more background on why we have that training provision.
Yeah, certainly. So it's a requirement to practice as an approved mental health professional. It's a postgraduate qualification at master's level, I believe, and it's the prerequisite for an AMP to practice. A local authority would not be able to warrant an AMP to practice without that qualification. So it's a red line. If people want to practice as AMPs, they need that training. And for me, it's part of the wider grow your own strategy. So Sharon was talking about growing our own social workers, which we do in adults as well. However, we obviously want to make sure that we're growing our own approved mental health professionals as well. In terms of the risk of individuals leaving, I think that's a risk that we need to bear. I've heard someone before tell me, what is the risk of training people and they leave? I would say, well, what's the risk of not training people and they stay? I think we've got an obligation to train our staff and think through that kind of future pipeline of talent that we want to remain in Powys. Many of those individuals that we are putting through that training have trained to be social workers and decided to stay in Powys already. And so the likelihood is that they will stay within Powys, but with more skills under their belt to deliver those statutory obligations. So I think it's the right thing to do. What I would say also is that the alternative would be relying on the agency market. It is significantly more expensive to recruit to an agency AMP than it is to have a permanent AMP. So it makes economic sense, I think, to invest in the short term training needs of individuals who are already permanently appointed, so we don't need to rely on that more expensive AMP provision in the longer term, agency AMP provision in the longer term.
Okay, doke. Thanks, Michael. Councillor Shan, did you want to come in on that point?
And I just wanted to double check something, because you asked about the legal requirement. Am I right in thinking, Michael, that we have to have, it's a legal requirement to have an AMP on duty 24/7?
Yes, it is. It is. Yeah. So
Yeah.
we have our day mental health services, but we also manage on behalf of children's services also our emergency duty team, and that is the place that will be contacted should there be a reason to undertake any Mental Health Act assessments outside of normal operating hours. And we've got an obligation to make sure that we've got sufficient AMP cover for that emergency duty team also.
Thank you both. Any other questions from members on pressures before we move on to cost efficiencies reductions? Okay, thank you. Right, so moving on then, obviously there's quite a lot to go through here. I just want to ask you again, like I did for children's, if you could just give us an overview of where you think the biggest risk in terms of achievability is in relation to these cost efficiencies, because there's no sort of RAG ratings this year. So how realistic do you feel this budget is? Where do you see the biggest areas of risk? That's my first question. I also am going to have to just head off for 5 minutes just to check my son. But I do want to ask some questions around the day centre review. So I will be coming back online in a minute. But if I could just hand over to Gareth, just for the next 5 minutes or so whilst Michael answers that. And then Gareth, are you able to start off the ball rolling with members asking general questions on efficiencies? But if you could leave the day centre one until I'm back, please, that would be great.
I shall try, Chair.
Thank you.
Right. Over to you, Michael.
Thank you. Thanks, Councillor. In terms of how realistic I think the budget is, I think it maintains a realistic budget. I think it's a continuation of many of the savings themes that we've shown we can deliver against in previous financial years. In many ways, a continuity approach to that work. But given the financial context that we face ourselves in, it's increasingly difficult, I think, to achieve efficiencies in general across the whole local authority. I think the biggest risks for me are probably associated with those savings that require significant staffing resource to realise. So the ongoing work around where people live, for example, that requires ample commissioning resource, operational resource, and also ongoing resource that we need to draw upon from our partnerships agencies as well. Similarly, the care and support transformation project in terms of strength-based reviews, that requires us being able to consciously target higher packages of care and doing that in a joined up way between ourselves and other agencies. There is also a risk, I think, associated with the funding body review. And again, that's something I think we can discuss in more detail in a closed session should people wish to do so. So yes, in summary, I think it is a realistic budget, but we also need to be realistic about the resource that's required to make it happen. I don't know if Rachel Evans has got anything that she wants to add to that, because I'm aware that many of these savings have got a commissioning element as well.
No, I think you've covered it well, Michael, and I can elaborate further when we come on to the commissioning section.
Any questions from members? Yes, Karina. You're on mute.
Thanks very much. Thanks very much. I'm just wondering about these direct payments. And is there any help for, perhaps an older person to procure their own care? And is there a register where a personal assistant might be, so that there's a sort of pool of staff? And what about monitoring?
Yeah.
Thank you.
Okay, thanks, Councillor. Again, I'll provide a high-level answer, and Rachel can come in with more detail if she wishes. Yes, we do. We want to make it as easy as possible for people to manage their own care and support. And a key means to do that is through direct payments. And so we have a direct payment support service that allows individuals to understand the realities of essentially becoming their own employer, employing a PA if that's how they choose to use their direct payment. And also over the past couple of years, we've committed to making it even easier to administrate the ongoing work associated with the direct payment through what we call our virtual wallet, which is essentially an online bank account that makes it as easy as possible to keep track of what you're paying, when you're paying it. It reduces the amount of paperwork that's required, and it just makes the whole process that little more seamless. In terms of having a list of PAs within the county, yes, we do have what we call our care and support provider. The idea being that if you're a PA and you want to deliver care and support within Powys, you can sign up to that care and support provider so that you're featured on that website. Similarly, if individuals are looking for a PA, they can log on to that website and find out about PAs within their area that might be a suitable match for them. Did you have another question, Councillor, or does that cover it?
What happens as an older person?
Yeah.
You often don't know what you need.
Ah, yes, yeah. Okay, so so the direct payment is in lieu of a commission service or a service that we would deliver internally. So the process, the process that we would go through to determine how much a direct payment is required is based on undertaking the usual assessment in the care and support plan. And then what the social worker or the assessor would do would be to cost up the amount that it would take to deliver upon that care and support plan. And that would be ultimately the level of direct payment that you would receive. So it's based on eligible care and support needs. And then in terms of actually reviewing whether or not that direct payment continues to meet the needs, that would be through our usual reviewing process. So we look to review care and support plans at the very least after the first 6 weeks, just to check that everything is kind of settled in. And then the code of practice tells us that we need to review at least every 1 year after. We do look in many cases to do that more frequently, that's how we would keep on track with whether or not that direct payment amount and the care and support that it's allowing the individual to purchase is the best way to meet the care and support needs.
It's just that you need to get in touch with a social worker to start off with. It's how you have the conversation. And I'm also wondering about that in connection with the older day older people's day centres as well.
Yeah, I think the question would be less about somebody requesting a direct payment. It would be somebody requesting an assessment to determine whether or not there's eligible care and support needs under the Act.
And how you do that, that's all.
Yeah. And then it's the usual process. We look to encourage uptake of direct payments as far as possible for many of the reasons that we've outlined today. First of all, it's often a more efficient way of meeting the needs, but secondly, it offers more choice and control for the individuals concerned as well. They've got that little bit more autonomy over how they use that funding. So, and actually from a Welsh perspective, I think we're one of the leaders when it comes to Welsh local authorities in terms of direct payment uptake.
It's just that I'm thinking one person in particular who doesn't know what is possible and what she might need as you get older. Yeah. Thank you.
Thank you.
Before I bring Councillor Glynn in, can I just ask a follow-up question, that Michael?
Yeah, sure.
You said you quite often follow up some people on direct payments more often than once a year. Is that because you in effect rag rated their needs?
It's on a case-by-case basis. Sometimes we have individuals proactively calling us or a family member or an advocate, and that may then mean that we review slightly earlier than we thought because we've been told that circumstances have changed. So it's on a case-by-case basis.
Yeah, okay, so a proactive measure.
Yeah,
okay.
Yeah.
Councillor Glynn.
Thanks so much, Michael, and thanks so much, Councillor Gareth. I must apologise if I've misinterpreted this this particular cost efficiency.
Mhm.
I appreciate the huge amount of work that's gone into this budget, but it does still blow my mind at various different points when I can't really understand, and things are not really written in plain English. So my reading of reference 129 as which is basically additional income on the basis of service users might will be deemed basically to be able to afford to pay for home care support. I was just wondering what impact assessment has been done to see whether people can really truly afford the support, given the impacts of the cost of living crisis, inflation running at 10%.
Yes.
And surely things have moved on quite significantly over the course of this budget setting period. And I'm just wondering how many people are going to be in that kind of forgotten middle, I suppose.
Sure.
So yeah, thanks so much.
Yeah, thanks, Councillor. It's a pertinent question, but at the same time quite a difficult one to answer, because everybody has got their own unique financial circumstances, and what we do to determine what the contribution should be is subject to those individual circumstances, and we undertake a financial assessment. So Welsh Government guidance tells us that for people in receipt of community care, they can be asked to contribute up to, but no more than £100 a week. In terms of residential care, it comes down to the level of capital and assets and disposable income that an individual may have. There is a minimum income guarantee that those individuals need to have at the end of that financial assessment, which is at the very least £35 a week. That's the guidance that we continue to work with. If there is any changes in that guidance from Welsh Government, our financial assessment thresholds will change accordingly. But I do take on your general point that charging anybody for anyone in the midst of a cost of living increase is less than ideal, but we have provision to do so.
Right, Councillor Amanda's back, so I'll hand back over to her, the chair.
Yeah. Thanks, Gareth. I'm here for the time being. Hoping to get my other son home soon, so I'm just going to crack on and see how it goes. Councillor Glynn, are you happy with the response to your question?
I am. Can I ask just one additional follow-up question, if that's just wondering. So I think I understood you correctly, Michael, but I'm just wondering, so for those people who've been asked not to contribute for their home care, at what points throughout the year might we reassess or keep in contact with those people? Or is it kind of reassessed on an annual basis? And if so, are you not concerned or worried about people who will fall into financial difficulty, I suppose, greater financial difficulty over the course of the year, given how rapidly the economic situation in the country has kind of how bad it's got so quickly?
Yes, it is a concern, and we will look at the financial circumstances as part of each of our reviews. I know that corporately there's been a lot of work undertaken in recent times to develop a cost of living hub. Perhaps we can get that link out to colleagues following this session, and that's really trying to bring together into one site various different support organisations, and also support that we can deliver internally as a council around income maximisation, and also looking at the various warm spaces that are available within the county as well, given the cost of utilities. We look to promote that as far as possible within adult services and at our front door, so we take into consideration those financial circumstances as far as possible.
Can I just come back with an observation, Chair?
Yep.
I'm totally appreciative of the cost of living hub. I've been promoting it myself. I'm really grateful of the work that's been taking place to put that together, because I think it's a fantastic resource. But it's just an observation about the way that the council communicates with residents more generally, is that is again a resource which is only accessible online, and actually is particularly given that we're in this Scrutiny Committee for Health and Social Care, particularly for older people, that they don't have access to the internet generally, or computers, and even if they did, they wouldn't have the foggiest how to get to the cost of living hub. So yeah, I suppose that's just an observation more than a question for you, Michael, I suppose, and probably goes beyond the remit of this committee as well. Sorry.
I don't think it does go beyond the remit, Glyn. I think there's a potential recommendation here in terms of tying it into our recommendation on that we made in scrutiny last week, in that, you know, when you're looking at ways to communicate, please use councillors and their local intel and the local ways that they use to communicate with their residents in terms of things like newsletters or community groups or coffee mornings or anything like that. You know, we can put that as a recommendation, as a more general recommendation, Glyn. It's an overarching really for anything that sits in this kind of area. Is that okay, Michael?
Yeah, certainly.
Okay, thank you. Any members got questions on cost efficiencies? Chris.
Yes, just wanted to pick up, it's on a related point really. In the cost efficiencies, you talk about technology being some of the ways of moving things forward on the again, it came up in one of the other discussions regarding the budget around things like Careline now are a challenge because of some of the changes to IT systems and accessibility to broadband. Have you factored that in within your risk assessment of those potential savings? Because if that isn't available in some of those areas, that could actually reduce some of the savings that you've anticipated.
We've not accounted for it in detail because we don't know the case-by-case basis. But what I can say, Councillor, is that much of our technology-enabled care doesn't always require being linked to a broadband connection. So there are various technology-enabled care options that don't require that internet connection. Again, when we assess and we look to find the most proportionate care and support plan, we will be assessing on an individual basis.
Happy, Chris?
Yes, thank you. That's fine.
Thanks, Michael. I've got a couple of questions to do with items 116 and 117 in the cost efficiencies to do with reducing travel and phone use by 10%. Can I just check you haven't covered this whilst I was off?
No, we've not answered any questions on it, no.
Okay, thank you. Just looking at the impact assessment, Michael, it says in relation to travel, there'll be a potential impact on staff wellbeing should staff have less opportunity to benefit from peer-to-peer support. I would ask, does that include an impact on staff supervision? I also then, looking through that impact assessment, given that comment under 4B of the impact assessment, I just wondered why further on in the impact assessment under point 6, when it looks on impacts on workforce, it says under 6B impact on workforce none. Is that, am I missing something, or is it a different type of impact? I just wasn't sure why there was no impact there when you've said there would be an impact earlier on. And just in relation to the impact of this, I'm for both the travel and the phone, I'm concerned about the impact on service users who are in the most rural areas, really, particularly for those who may be reached by phone rather than travel, or it may be because they're in the most rural areas, staff feel like they should maybe not travel because they've got this 10% target. How are you going to give guidance to staff on how to decide whether or not to get in the car or pick up the phone? How is this going to work in practice? I have got some concerns here, I'm afraid.
Okay, in terms of the travel efficiency target, I think there is a potential initial impact on frontline staff. However, we think we can mitigate that because the majority of that travel efficiency target will be met by individuals that are not frontline practitioners, many of whom under the New Ways of Working programme are working far more flexibly and not working in offices or travelling to and from offices on a day-to-day basis. So a significant amount of that reduction will be achieved through non-frontline staff. In terms of how we'll actually make it work in practice, as I say, I don't think it should have a significant impact on the deliberations of our frontline practitioners in deciding whether to phone somebody or go out to somebody's house. We need to preserve that relational based way of working, and I think one of the best ways that we can really get to grips with what matters to individuals is to travel to where the individual is based, to develop that relationship. Ultimately, I don't believe we will be compromised in doing that with this efficiency target, but that's because the majority of our staff are now classed as flexible workers, which means we have more people working from home than we did previously in non-frontline practitioner roles.
Okay, I think that's covering it. Probably the point that hasn't quite been answered is, I appreciate they're not necessarily frontline, but how are they going to be given guidance as to whether or not they do travel or don't travel, or do use the phone or don't use the phone? How do you achieve this 10% in practice?
I think the 10% will be achieved in practice through the non-frontline practitioners reducing their travel. In terms of determining whether or not a frontline practitioner phones a client or goes out to see somebody, I think we need to base those decisions on a case-by-case basis. For some individuals, they may prefer an initial telephone contact as opposed to an initial face-to-face contact. But ultimately, this requires line management oversight and on a team-by-team basis through team meetings. Practitioners and team managers can work out a means of communicating with service users that works for them. Okay,
I'll be interested in seeing this, I think, in the going forward. I appreciate it's not huge amounts of money we're talking about. I just interested in how it's going to be measured and rolled out, really. Right, who else is? Oh, Councillor Shan, did you want to come in on that?
Yeah, thanks, Amanda. So with reference to the specific question that you asked around the potential impact on staff from losing the peer-to-peer support, that came from me originally, and I was just aware that staff quite often talk about how much support they get informally, you know, both of two people waiting for a kettle to boil in an office, and with so much more home working rather than all of us going into offices and being with our teams. I wondered whether there would be an impact there, but I know that a range of measures are being put in place. Looking at staff wellbeing is an ongoing concern of managers in adult social care, and a range of measures are being put in place to help staff manage wellbeing related issues.
Okay, thanks, Sean. Councillor Gareth.
Yeah, mine's perhaps a follow-up question to what the point that Councillor Sean's just made. In the discussion we had around children's services, Sharon said that they're encouraging staff to go back into the offices on a 2-day-a-week basis. I'm just wondering, is there any proposal like that around adults, Michael?
Yeah, thank you, Councillor. If I can just come back on the previous question first of all, and then I'll answer that query as well. I just wanted to clarify that for staff that have got a contractual office base and are travelling from their home to the office, that travel is not reimbursed by the council anyway, so that's not affected by this proposal. In terms of encouraging staff back into offices, absolutely, we are. We've not been prescriptive about it because every team has got their own specific wants and needs. What we have said as a senior manager team is that we want team managers to have those discussions within their teams to determine what works for them. And what we've actually found over the past few months is that some teams are deciding to meet up face-to-face, but not necessarily in a traditional office environment, meeting in more of a community-based setting and having team meetings or reflective practice sessions in different settings across the county. So we're very flexible on how teams want to use their time, but we do need to, I think, restrike that balance post-pandemic of time when people are working from home and liaising with each other on Zoom and Teams versus that valuable face-to-face time, especially when it comes to adult services and the need to undertake that reflective practice and seek guidance around maybe sort of thorny case management issues. So there's definitely a place for both, and we encourage both.
Yeah, and I would agree with you. And I know Chairman and myself has had the same conversation on email around the actual committee as well, whether we should be face to face, etc. So
yeah, thanks both. Any other questions from members on efficiencies? I've got a question, Michael, on the line 125 relating to the provision of informal advocacy.
Yep.
And this is to do with you putting aside monies for it not being used. I just and now there's I think what you're saying is informal advocacy is provided by other means. Can I just ask, have you engaged with service users on this to make sure that they're aware of how to access informal advocacy through those other means, or how do you communicate that to them?
Yeah, those individuals will be made aware of that through the assessment and care and support planning process. If it transpires that an advocate is required, our social workers and our practitioners have got a list of those organisations that can assist, and then it's our role to make sure that those service users are linked into the relevant support. So it's on a case by case basis when that need arises.
But so people do access those alternative means already, do they?
Yes, they do. Yeah.
Okay, so they're up and running. That's
yes.
That's answered my question. Thank you.
Yeah.
Again, I think this is probably my last question before we come on to the potential review of day services and the anything else that might need to be in confidential session.
Yeah.
The line 126 inefficiencies, again to do with the provision for learning disabilities, and there being one centre that's not being fully utilised. I just wondered, how long has this been not fully utilised for? Why? And is it because it's not a suitable building? What's the background to it, please?
Yeah, so it's not being utilised because post-COVID, what we saw was very low numbers returning. The building itself was being used for sensory rooms and alternative sensory experiences. The demand for that particular building in that setting was very low, and we were also aware that we could deliver something very similar at another Powys base very close by. So it was based on that rationale that we didn't think it was good use of our money to continue paying to rent that room.
Okay, thank you. So the demand, the demand dropped off because of COVID. Is the communication that service still exists maintained?
Yes, yeah. So any of those individuals that were going along to that existing setting will now be going along to the alternative setting. So we've got that continuity of support in place.
Okay, great, thank you. And I think that's it on sort of areas that may not, which won't be in confidential. I don't want to go straight into confidential, Michael, in relation to the day services centres. I would like you to say if you feel we are treading on sensitive commercial or confidential matters, and if so, give some reasons why before we do go into confidential session, so that we're fully transparent with the public. My starting point is to make an observation that there's no impact assessment in relation to this wider review of day services centres. I also note that is it 120,000, Michael?
Yes.
Yeah. Can I ask then, what's the actual total budget for day services, and are you able to sort of give an indication as to how you've come up with this 120,000 figure? Because obviously you've gone through everything with a lot of thought behind it, and you've provided impact assessments for everything else. Why is this not got an impact assessment? And can you give us a little bit more detail?
Yeah, sure. There is an impact assessment. Unfortunately, it wasn't published in time for the scrutiny session that we're undertaking today. It was an impact assessment that was published too late to make the cut for the papers that we see today. In terms of the approximate costs of running in-house day centres in Powys, we've got 5 day centres, and that totals to just over £1 million per year. That's largely based on staffing costs. We also commission some external day provision as well, but what I can tell you just now in terms of figures is the overall running cost of the internal older people day centre provision. In terms of in terms of how we got to the 120,000, so we do believe that there's potential efficiencies that can be made here. However, we want to undertake a consultation with residents, with affected stakeholders, before we discuss anything in an open scrutiny session about what our intentions are. Personally, I think that's the right thing to do. We've got lots of affected individuals that attend day centres, families and loved ones who support people to attend day centres, and they all have a stake in understanding and putting forward ideas as to what meaningful day opportunities may look like. So the intention is to undertake a consultation, and when that consultation concludes, we will then be in a position, I think, to offer some more detailed proposals, which would in turn have a more detailed impact assessment against it. So the 120k is partly an estimate at this point in time, but it's partly because there are some existing contracts that we have with other providers that would allow us to provide day opportunities in a slightly different way. So we could maintain that continuity of day opportunity provision within those localities, but it may mean that somebody else was delivering it. That's when we start getting into the commercial sensitivities, and I prefer that we have that discussion in a closed session if that's possible.
I appreciate that, and I agree that you absolutely need to consult, and I've also already mentioned to both you and Councillor Sharon previously that this is something that I would want to come to scrutiny before any decisions are made, so that we can see service users' comments on that consultation, and we can assess the impact of those different options before you make a final decision, or Cabinet makes a final decision on which avenues to pursue. I'm still therefore concerned about this 120,000 figure, in that as a committee, it's very difficult for us to scrutinise the impact of this, and I can't really see how we're going to do that in private session either, because you haven't done the consultation. And you're nodding. Councillor Shahan, is there anything you want to add to this?
No, I'm appreciating the difficulty.
Yeah, Nina, do you want to come in on this one?
Yeah, thank you, Chair. Yeah, I note the comments that you're making and the committee are making here today. I mean, obviously, as a service, we're trying to do all that we can to help the council achieve the £16+ million savings that need to be made. We believe as officers that there is going to be a part-year efficiency that can be made during the next financial year. So we were keen to put a figure forward, but we absolutely accept that at this stage, that is an estimate, and that review needs to be undertaken, and that consultation work needs to be undertaken so that we can come back with a full business case. I would just say and provide, at this stage, that I would really hope that you and Scrutiny Committee will be very much involved in that review throughout the process, and we would welcome your input into that. We think it would be very valuable. So it would be mid-year that we'd be looking to kind of conclude that review and come back with the business case and the more detailed, and obviously the detailed around any potential efficiencies. If the figure, it may have to be adjusted, when we've completed that work, and we'll deal with that at risk in the next financial year. But I note the kind of challenge that you're putting back to us. But as a service, we were just trying to do all that we can to help the council meet the efficiency savings targets that need to be met in the next financial year.
Thank you, Nina. We absolutely will want to be involved, and at the earliest opportunity. And also, as part of that, I really want to hear from service users if there is a way of inviting anybody and or staff as well to speak to us about that. You know, I don't want this to be a retrospective exercise that we're involved in. And I'm going to come on to Glyn in a second, but you know, as we've been doing this process, we've been asking you for almost for assurances on whether this is realistic or is the impact mitigated. You know, that's the crux of our questioning, isn't it? We're trying to get to a point where we're comfortable of ourselves, that we have given you the opportunity to justify your budget, and I'm not comfortable that we have been able to do this on this line, and so we can't really conclude with a recommendation other than saying that, because we haven't seen the impact assessment. You know, for all we know, you may do that consultation exercise and you may not be able to make that saving, or you may be able to make much more, or it might go and turn into a completely different exercise based on how it develops. So I think we're going to have some careful wording on our recommendations here. Councillor Glyn.
I suppose I'd just like to well, I suppose I'd just like to reiterate your comments, Councillor Amanda, and the frustration that there's a figure put there in cost savings, and Scrutiny don't really know what that actually means. And I'll just make another observation, and I'm not trying to be negative, because I know a huge amount of work has been undertaken to ensure that, you know, you can get to the necessary cost savings for this budget for this financial year. But the last time I was told as a local member, and you know, I've only been a councillor for 8 months, but the last time I was told as a local member that I couldn't be involved in the decision-making process or told in advance was due to commercial sensitivities. You know, a decision was taken to close leisure centres, temporarily close leisure centres, without local members having a say or there being a proper consultation process. And so I'm just concerned that there's an element of kind of predetermination here, whereby you know, but there we go. I suppose I'm just noting that concern at this stage. I don't know whether anyone wants to respond to that.
I think, Glyn, we have to be very careful about using words like predetermination, but I appreciate the point you're making about local member consultation, and I would reiterate that in urging the officers and the portfolio holder to ensure that they absolutely involve local members at the earliest opportunity, because local members will help you consult on this. They will know who within their wards will not necessarily. I think why this is so important is because so much has changed during the pandemic, and there may be a idea that actually people don't want day centres to come back because they haven't gone back to using them. But I think that you need to really assess whether or not that is the case. And if that is the case, does that mean that actually there's something much more suitable as an alternative that could be provided instead, which would actually enhance what they had before? And so I would want to see a really positive and a creative exploration of ideas as part of this process. Nina.
Yeah, no, thank you. Just to kind of conclude there, you know, absolutely note the comments that you're making, and we'll take those away to reflect on them now as well after this scrutiny committee. But just to provide that assurance that, you know, absolutely yourselves as scrutiny, and you're absolutely right, local councillors need to make sure that, you know, you're all really fully engaged and involved in this consultation and this review. And so I can see Councillor Shan's nodding as well. Just wanted to give you you know, assurance from ourselves today that we will do that moving forward.
That will be two recommendations from us on that point. A, us, and B, local members.
Absolutely, thank you.
Anything else, members? Councillor Shan.
Yes, it was just to reiterate that assurance that I would personally take part in making sure that local councillors are consulted.
Great, thank you, Shan. I've got questions, but they're to do with the funding body, appropriate body paying for the appropriate part of the service, which I think means that we're going to have to move into private session. Someone's got their hand up and I can't see who it is. Nina.
Yeah, thank you, Chair. I just note that Rachel Evans still has a number of slides to move through
Oh,
for
gosh,
her area. So
yes.
did you want to do that before we move into confidential
Yes,
session?
we do, and I think they'll be fairly quick because this was fairly self-explanatory, Rachel, and we haven't come up with any pre-questions on this, but thank you. Thanks
Yeah,
for that
sure.
reminder, Nina.
Thank you,
Sorry.
Chair. I'm going to leave my my camera off because I can see that it's been flickering, so I apologise for that. So I'll leave the camera off. Just waiting for the presentation to load. I'll try and move through this quite quickly because I'm mindful of time.
Apologies, my computer was just being a bit slow. Is that
That's
sharing
okay.
now?
It's coming through. Okay, thank you. I thought it would be helpful just to give a very brief overview around commissioning and partnership services generally. So commissioning, just in terms of a description of the service, is an integral element of children and adult social services, which means that the departments work together in collaboration to meet the priorities and vision as set out by both heads of service today. So it's really important to emphasise that. Essentially, the budget is a staff budget, which is around 3.6 million. And just in terms of the workforce, the team is split into three main areas, which is Start Well, Live Well and Age Well, which is consistent with the health and care strategy. Start Well, covering areas of commissioning for children and young persons provision and coordination of a range of grants such as children's and community grants. Live Well involves strategic oversight of services such as learning disability, mental health, community equipment and technology, and also includes substance use and housing support grant. And then Age Well is around domiciliary care, care homes, extra care provision and direct payments. And right at the heart of that, we have a really good team, which is focused around contracting and brokerage. And one of the things we've talked about earlier is around some of the pressures around contracted services. So they perform a really important function. It's really pertinent to note as well that the workforce consists of a mix of short-term grant-funded staff as well as core funded, and some of the short-term grant is around using grant to undertake innovative ways of working, such as and using regional integration funding. In terms of the purpose of the team, they have a really core role in terms of providing support and enabling a function around commercial activity within social services, which is a considerable amount of spend. So it performs a really important function and support function around that commercial activity. And it's also responsible for delivering high quality, cost effective and contract managed services. And we do this by having robust contract monitoring systems in place. But the other key function of the team is to undertake a strategic planning to meet the population need going forward. And this is about using a range of information and intelligence to understand how the outcomes of the population can be met in future in terms of service delivery, but also planning ways to prevent people from needing services. And then finally, I think it's really important to highlight the fact that within the team, there's oversight around the housing support grant and the substance and alcohol use. And I think I just wanted to highlight that this provides a natural alignment and bridge to other services and partners. And I think it's really important to emphasize that. So that's just an overview of the team. In terms of the next slide, I'm going to hand over to Jackie, who will just talk very briefly about this.
Okay, thank you. So the commissioning budget, base budget for this financial year is 3.647 million. The pay award for 22-23 that needs funding is 139k. The pay award for 23-24, the 3% is 97k. The non-pay uplifts amount to 18k. There are no pressures. The savings that have been identified are a total of 97k, giving a request for 23-24 to be funded of 3.805 million, which is an increase of 158 thousand, which is 4.3%. Thank you.
Okay, thank you. And just coming on to the commissioning services savings overview, just to introduce this slide, I just wanted to give a high level of confidence that the following proposals are realistic, deliverable, legal and affordable. So just taking them line by line, in terms of the first one, which is the vacant post. So this post has been vacant for some time. We haven't undertaken a recruitment for a range of reasons, some of which has been as a result of pause in some of the activity around some of the project work through the COVID period. So we're confident that we can absorb and disseminate this additional workload, and we have done over a number of years. So we're quite confident that this is a very, very low risk reduction. The following line then is in relation to reduction of travel. As we've already talked about, the nature of the roles are well understood, certainly within commissioning. A good section of the roles are do not require a range of travel. There are some roles that are absolutely essential in terms of those travel, but we know which ones they are. A lot of the roles can be undertaken in that flexible way, and we've already gone through a process of new ways of working. We understand which roles require a lot of travel and which ones don't. We have lots of meetings with staff and regulatory meetings to really assess that. And so far we've been able to keep that to a minimum unless absolutely necessary. In terms of vacancy slippage, again, this is very straightforward. This is around briefly pausing on recruitment, and that wouldn't have any impact on any service delivery at all. Mobile phones, again, that's really straightforward, and we've already encouraged staff to bring their own phone, and that's working relatively well. The next line then is in relation to a grade 5 part-time role, and that's about utilising grants in order to contribute to that role. This role already provides support around children's and community, so the grant condition absolutely permits the use of that grant to fund those roles. So that is, clearly compliant. The grant is sustainable, and we've already had an uplift of that. So it doesn't mean that any other services are reduced as a result of using that grant. And then the final one, just to put all of those together, again, is around utilising children's and communities grant for a range of various activities that are currently baseline funded. The grant conditions make it quite clear that it's these provision is eligible, it's permissible and legal, and actually provides no or minimum risk in terms of using that grant in that way. And that concludes the savings overview for commissioning.
Thanks, Rachel. Wyn, can I just check that we're still quorate? I think Councillor Glynn has got to leave, and I'm just concerned that a number of other councillors have left as well.
So look, 1, 2, 3, 4. You've got 4. You're just on the borders of. Yeah,
is that 4 once Glynn's gone?
No. Yes, 4 once Glynn's gone.
Okay, yeah, okay. Glynn, if you want to go, that's absolutely fine. Or sorry, if you need to go, that's absolutely fine. We're just about quorate, and I think we're coming to the end of things. Thank you, thanks, Rachel. Have any members got any questions on the commissioning side of things? I found that to be fairly comprehensive and has addressed the questions on risk and achievability. Councillor Gareth, I can see you've got your hand up.
Just very quickly. Rachel, you said with regard to the phones that you encourage staff to bring their own mobile phones in. Are you intending to reimburse staff for the usage of the mobiles or not?
So this is the council policy in terms of bring your own phone. So there's already a process in place around that, but it wouldn't be involving reimbursing staff.
Okay, thank you.
Thanks, Gareth. Any other questions from members? Chris?
Thank you. Can I just ask again, in just relation to the mobile phones, if someone using their personal phones, they're now far more sophisticated than what they used to be. So therefore, if any, individual data and about ensuring about personal protection of that, has that been covered off, and is it covered off with staff going through? And then the other question is in relation to grants. I mean, I see them being utilised, but going forward into future years, does that then put those pressures, do they come back in for 24-25, for example, or are they, is those grants going to continue into future years?
Yeah, so just going back on the mobile phone. So just to just reiterate the point that that bring your own phone is in line with council policy, and there are a range of safeguards in place that staff have to follow in order to make sure that that personal data and the security on the use of that phone is in place, and that's very much supported by ICT, and there's a clear set of instructions in place in order for that to happen. So if devices do get lost, then there's very limited risk that that personal information is able to be accessed by anybody. So that's very much in line with the council policy. And the second point in relation to grant is in relation to the use of children's and communities grant. So that is quite a robust grant in place. We have a high level of certainty that that will continue into the future. We have had an uplift last year and a small uplift this year in relation to inflation. So we are confident that that will continue. That's a high level of confidence. So that's the Children's and Communities Grant, which brings together several grants all together in one place, and allows for flexibility to be able to move money around between those grants as well. And that's within the grant conditions to do so. So there's a high level of flexibility within the use of those grants.
Thanks,
Thank
Rachel.
you.
Any other questions?
My video back off again. I can see him flickering.
Any other questions from members on commissioning? No. Okay, in that case, we will go into private session, I think, just to wrap up on some of the final things. Just before we do that, Councillor Gareth, just for the public's benefit, have you got us a note of what recommendations we've made so far?
Yes.
Are you able just to give a quick rundown in relation to those?
I haven't got many. I've got 6 in total. One in children's, and I think this applies to adults. And that just on the committee would like to see the proposed savings are RAG rated. And then in respect of adults, is the committee felt that the contract related pressures should be treated as a separate column in figure 8 and not included in with other pressures and growth items. I know that's not been discussed this afternoon, but that's one I think we should have, because the contracted service in my mind is similar to a pay award, and pay is treated separately. Second one for adults is linked to the charges. The committee would like the authority to consider further how to communicate with the hard to reach and vulnerable members of the community, and how it utilises both the individual county councils and members of the town and community councils to achieve this aim. Concern is raised how the travel and phone efficient targets will impact on the services provided to clients and on the individual members of staff themselves. Concern is raised in respect to the 120,000 efficiency savings in respect to the day centres and how this level of efficiency will be achieved, and that the council and cabinet need to ensure that the scrutiny committee and relevant local members are consulted on in respect to any consultation on service change in the county stroke local area.
Okay, thanks, Gareth. Going back to children's, I think we also mentioned about having some more information in the Q1 financial review in relation to the additional placement costs and how that is materialising throughout the year. And the point on RAG rating, I don't think it's that we need to see a RAG rating per se as it was previously. I think it's just, you know, that we just made the point that as part of our questioning, we needed to understand their view on risk and achievability, given that that isn't included within the papers. So yeah, that's great. Thanks for doing that, Gareth. One final thing before we mop up, and that is just again, I know we may move into this in the private session, but on the day centre stuff, Michael, you mentioned about the impact report actually having been done. Would you accept written comments from this committee if we're able to see that over the next week or so?
Yes, of course.
Okay, we will ask for that then as a recommendation, that we have that in we get given sent that, sorry, I can't get my thoughts out now, that we get given sent that, and we then we'll provide you some further comments if we want to. And on that note, thanks everybody for attending and watching. Thank you to officers and portfolio holders. Really appreciate those presentations. They've been really comprehensive and have helped focus our minds. And on that note, Wyn, please can we go into private session?
The members of the committee who are still here, please to pass the confidential resolution.
Oh, do we? What do I need to do?
No, it's I'll word it, but there's a specific resolution just to go into confidence. And if that committee's happy to pass that, then I'll stop
just
recording.
To note, the reasons are commercial sensitivities in relation to contracts, and also, Michael, to do with legal cases that are in existence. Is that right?
Yes, that's correct.
Thank you. Anyone got any issues with us going into private session? Who's on the committee?
Happy to go.
Okay, thank you. If we could pass that resolution, please.
Thank you, Chair. Bear with me. I'll just stop recording.